breathing.
He's struggling to breathe.
Very seriously injured.
In some of the UK's most remote places.
Stay on the line and I'll tell you exactly what to do next.
There's just been an accident on the M1 motorway. It's on fire and it's gone into the railway bridge.
Your life is on the line.
How far did he fall?
About 5 metres.
He's intubated and ventilated.
You need some of Britain's most elite medics.
Is there any serious bleeding?
Yes, there is, yeah.
Can't feel legs, anything below my neck.
We're in a remote location in the middle of a woodland. They've broken their back.
The speed of the Yorkshire Air Ambulance can make the difference between life and death.
Your discretion, take off.
FedEx 99 lifted.
Today, a mountain biker hits rocks head first. He's lost all sensation from the neck down.
Felt like my head was just rolling down the hill.
Yeah.
Couldn't feel legs, anything.
A driver and passenger are trapped in their car after it left the road and cartwheeled into trees.
Come off the road at speed. Access is quite difficult. We've also got a ditch full of water.
Nice and still for me, my friend.
And the team fly into an isolated farm to rescue a tractor driver injured in a freak accident.
This chap was with her. He thought she was dead. So.
Hey, Desk, it's Tony.
At Helimed headquarters, paramedic Tony Wilkes is on the phone to the ambulance service control room. There's an emergency in Woodland on the edge of the Peak District.
Looks like we've got a job, mate. Is it mountain biking? Yeah.
The rider is lying badly injured.
ARD will need mountain rescue for that probably as well.
Helimed 98 is off the ground in less than a minute. They'll be over the emergency scene in 10.
Tell me exactly what's happened.
We're in a remote location in the middle of a woodland. The patient has fallen off the bike. They're complaining that they've broken their back. They can't feel their arms and their legs.
Eyes out, we're around here somewhere.
Yeah, looking.
Paramedic James Stubley is navigating today. The patient is in luck. James is a mountain rescue leader with an encyclopedic knowledge of the Peak District.
This road is where they'll access with the RRV, the road that runs in Peak.
The RV's just below us now.
Yeah.
All right. Where, you know where the runs off?
There's runs both sides of the road, that's the trouble.
It's probably nearly 2 miles
Oh dear.
from the lock gate to where the patient is.
Okay.
So that's why I'm saying that we might need the fire brigade to cut the lock off.
Right, okay.
They're flying over one of Yorkshire's most popular and dangerous mountain biking sites.
But on the far side near the car park, there's a lot of downhill black runs.
On the other side?
On the other side where the car park was going out, further out, yeah.
I can't see out at all.
But it's still not going to be easy to find the casualty. They only have vague directions from the 999 call to go on.
Do you want to put it down in that field below us and I'll ask them?
The woods below cover thousands of acres, and the team has few clues to the scene of the accident.
RRV just pulling up the car park, so...
It is tight left and right.
Clear left, other than the trees.
Clear right, mate. It's very boggy underfoot.
Yeah.
Pilot Gary's touching down, so paramedic Paul Holmes can ask other bikers if they have any clues.
Bit more firmer there, mate.
Okay to get out, Gary? Yeah, I'm just going to go to idle. I'll wait here for you, mate. Yeah, sound.
There is a field, but then there's quite a high gate.
Aye. We'll sort that out.
This guy seems to know where there might be a key.
It seems the man's lying on a gated track deeper into the woods. And worryingly, he's showing signs of paralysis.
Right, he's about 1.5 miles down that track. There's a cyclist going to go down the track to where he is. The track on our left-hand side? Yeah, where them people are. Okay, mate. No. Right, we have no wind, so I'm just going to go straight up, turn round and straight up here.
What's Bronze going to do? Is she going to go down?
Yeah, she's going to go as far as she can to try and get a key for the gate for where the patient is.
The key on Middlewood Station for it. I put it there myself. 4 years ago.
I don't want to say I told you so, but... Is that the cyclist there?
Yeah.
You follow him, he'll take us to where he is then. Have I got to go at cyclist speed? Oh, there's someone waving now. 3 o'clock. 3 o'clock, not seen? In the tree line. got the wires. It's staying in the logo and the wires.
This is Kurt from 98 Visual Routine, just looking to land.
Right, not to land on a rock, that's all.
You've got some rocks to you right now.
Yeah.
Gary's touching down as close to the accident scene as he can. From here on, the team's on foot.
Hi, are you all right? Oh, this is the one where we need the keys. Can I just give you that a second, mate, and I'll climb over.
At last, veteran mountain biker Rob Hobson is about to get the help he needs.
Must have been there over half an hour now, then.
Yeah. Right, OK. What's his name?
Rob.
Rob. Hello, Rob. My name's Paul. All right, mate, tell me what's happened.
Right, I've gone down that gnarly bit there, trying to go over the handlebars.
OK.
Hold it, and then it just gripped and then chucked me over the handlebars.
Right,
and
OK.
It just went head first into a rock straight on the top of my head.
His impact's here, look.
Right, yeah.
Right, so, and as soon as I hit that, literally my body went numb from the neck down.
Right, OK.
Felt like my head was just rolling down the hill.
Yeah.
Couldn't feel legs, anything below my neck.
Right, OK.
And then now I've been laid here a bit. Obviously, look, I can wobble my feet.
Sure, yeah.
And I can start to move them. But I've just got massive burning pins and needles in like my shoulders, across my chest, this arm.
Right, so is it across your front more than your back, is it?
Yeah, I think so. It's
right,
just,
okay.
it's these arms just feel dead.
Rob's symptoms are very serious. Pins and needles are a classic sign of a spinal cord injury.
We'll get your helmet off in a few minutes, Rob, but I wanted to give you a quick assessment, mate.
Right.
Obviously, your job is to make sure you don't move his head.
One wrong movement could kill their patient. Paul knows the impact could have caused other severe injuries. He wants to rule out other problems before dealing with Rob's spine. And the most critical stage in this rescue is about to begin. Paul must remove Rob's helmet and straighten his neck. It's a risky procedure, but it's got to be done. It's an old joke, but the Yorkshire Dales really can experience 4 seasons in 1 week. After a few days of sunshine, snow and ice are causing treacherous conditions on the roads.
What we got? Okay, cheers, mate. Driver unconscious.
Now there's a serious accident. The flight to the outskirts of Harrogate will take 15 minutes from their base in Topcliffe.
After traffic, and I made 9 Alpha engine mode start, outbound Harrogate.
9 Alpha, taking up your discretion, present position, surface with 20011, crossover runway.
Pete Rhodes is the lead paramedic today. With over 20 years' experience, he's seen hundreds of car smashes. And he knows accidents involving trees are among the most serious. Crumple zones and airbags can do little to protect drivers or their passengers. More information is coming through from the emergency services already at the scene. With winds gusting to 40 miles an hour, it's going to be a bumpy ride for pilot Ian Musette, along with his navigator and paramedic Leon Baranowski.
I'm trying to get the right amount of pedaling. We're flying a little bit out of balance at the moment.
The aircraft is getting buffeted from side to side. Ian's working hard to keep it on an even keel. Landing can be the most difficult part of the flight, even without high winds. As they approach the accident scene, extreme precision will be required to get the air ambulance down safely. The driver and passenger are injured and trapped, but with the car in such a precarious position, firefighters must secure it before the patients can be taken out of the wreckage.
It's come off the road at speed and it's managed to trap itself between some hedgerow and trees and things, so access is quite difficult. We've also got a ditch full of water, so access is quite an issue at the moment. We've got plenty of personnel on site, crews from the ambulance and from fire service, making sure all the times that this vehicle is stable, because it's part in the air, so we've also attached it to the trees using some of our strops to maintain that stability for the casualty and also for the crew's safety.
With the car secure, the firefighters' priority is to get the passenger, who's called Natalia, safely out. Pete suspects that both she and boyfriend Martin may have spinal injuries. This must be a delicate procedure.
Looking at what could have happened,
car versus trees at 40 miles per hour. It looks like they've probably been relatively quite lucky.
Both Natalia and Martin are Polish. English is a second language.
Language difficulties can cause quite a few problems when you're trying to assess patients. In trauma, though, it's relatively easy because you can usually see where the problem is, or at least find easily where the problem is. In medical patients, it takes a little bit more in terms of investigative questioning. Then it's a lot harder to do. The ambulance service does have a setup for that. We can use an interpreter through a language line, but the process of getting all of that in place whilst on scene can be quite lengthy at times. So usually we do our best to muddle on through and just go with the stock words and the stock hand signs.
Stay still, Martin. Martin. Nice and still for me, my friend. We've got a blanket coming over to keep her warm now.
Like Natalia, Martin needs to be brought out of the car horizontally to avoid damaging his spine. The high winds mean that for once, both casualties will have a smoother ride going to hospital by road.
That seat will fall down with a polo. That boot's going to get unbolted. He will literally go straight out of there if you wanted to.
Perfect, yeah.
Everything is geared up at the back. Do you want to look at the space at the back? Because if you're happy, we'll go with it. I'll just show you now.
Hey, that's 21. All patients are going to be going by road to Harrogate, so we're not going to be conveying anyone.
As Natalia is taken to the ambulance, the tricky procedure of getting Martin onto a spinal stretcher is underway.
Can you get us another extrication ball, please, mate, for getting this? Yeah. We'll slide him out. It'd be easier to slide him out than that, that's all.
If Pete's suspicions of a spinal injury are correct, one false move at this stage could leave the patient paralysed.
Trust us. Yeah, you've got to relax and trust us. We practice this a lot, OK?
Deep in the woods, on the edge of the Peak District, 49-year-old mountain biker Rob Hobson is lying critically injured. His neck is feared broken.
I just heard quite a loud noise going down the slope. Yeah, I just went to see if he was okay, and he was complaining that he kind of couldn't feel his arms and his legs, so obviously quite serious, so I just called the ambulance.
Are you comfortable as best as you can be? Because I don't want to move you just because there's a rock just at the minute. There's no pain in your stomach, is there?
He thought he couldn't feel his legs or anything like that, but we saw him moving his legs. We just tried to calm him down, really. He kept sort of saying, "It's bad, mate, it's bad." It's a bit of a worry.
In a few minutes, once we've just done your blood pressure, Rob, we're going to sort you out, mate. All right, how old are you?
It was a sort of consensus talk earlier on that we said we're not going to do anything too silly. And, it happens.
Paul and James are going to need help from Mountain Rescue to move their patient.
MRT are about 5 minutes off. Okay, yeah. I'm just giving him a grid now.
That's fine. What we're going to do then, obviously, because we don't know what's happened to you, your neck particularly, and because you've got this loss of sensation, numbness and what have you, as you're probably already thinking, we're going to treat you for worst case scenario.
Yeah.
I'll carry on physically just giving you a quick once over, just to make sure we're not missing anything.
Yeah.
Okay, mate, we don't want you to do anything, but if you get any pain, shout us. Are you ready, mate?
Paramedic Paul must now remove Rob's helmet. A mistake now could kill their patient. James is holding Rob's head rigid, but the next stage is even more critical.
Right, Rob, we're going to have to straighten your neck slightly. There's no C-spine tendons. We're going to go to you, so you can look into your right. So I'll do it.
Look towards Al.
All right.
Straightening Rob's neck is necessary, but fraught with danger.
You just keep your head nice and still. You can let go now, mate, thanks. Nice and slow.
Can you move
How's
that
that?
right arm, boss?
Limited movement.
Rob's life is in the team's hands.
Yeah. So you've still got no pain in your neck?
No.
Fantastic. Slow, you've been nice and steady. You're doing really well there, Bob. I know it's uncomfortable, mate.
Yeah.
All right, and I know it's quite scary.
You don't think to do?
No,
So just bear with us.
At last, it's done. Now they can protect Rob's neck with a surgical collar. A mountain rescue team has arrived.
Hiya, mate, all right. Just going to be from your guys' point of view, some hands when we transfer him, but probably just a bell stretcher just to get him back up to aircraft.
Right, we've got plenty of hands here.
It's fine.
But getting Rob to the chopper won't be easy. He's come off on a very steep track. Mountain Rescue are going to provide the manpower the team needs.
If we're all set.
This is going to be uncomfortable, Rob.
Okay. Ready to lift.
Yeah, ready.
And lift. Oh. That's good. That's all good. And we're there.
Good enough.
And down, call it.
Ready to lower.
Yeah.
And lower.
We'll get your head up in a minute, boss, as well.
We've just scooped him up now. Mountain Rescue are just getting him out on one of their stretchers. To be honest, we've got plenty of hands actually.
I'll leave the lock to the gate on it, well, not lock it, so that they can access out over.
Yeah, that's great. Thanks, Leslie. Thanks for your help, Doug.
These guys are now going to carry up this track. We're going to get you to the aircraft and then we're going to fly you to Sheffield. So it's only going to be the shortest flight on record, probably.
Yeah.
All right, but we'll get you there smoothly, at least. Yeah. All right, mate.
Hi, it's Helimed 98. We've got a trauma call feed up, please.
It's less than 2 hours since Rob arrived in the woods on a day trip from his home in Lincoln. Now he's on his way to a lengthy stay in hospital.
Hi, it's Paul, one of the paramedics off the air ambulance. Called a 49-year-old male. He's come down quite a distance along a rocky path on his bike. He's come over the handlebars and landed head first onto a rock.
Even for the seasoned mountain rescue team, it's been a tricky operation.
Well, it just demonstrates how difficult it is. Even though it's a short distance, it is quite difficult, especially with the underground conditions and the kind of injury the chap had as well, potential injury the chap had.
We need to go feet first.
Accidents in Warncliffe Woods are common, but they're rarely this serious or this far off the beaten track. The team's flying Rob direct to the Sheffield Northern General Hospital, 10 miles away. It's the regional trauma unit.
Element 982, desk on approach, Northern General. They're all in the hover. High hover, just about to blow away.
Oh lad, look at him. Sheltering behind building, bless him.
How's that feeling? Is it coming back?
A little bit, but it just really burns in my elbows and
in your elbows.
Shoulders.
The team know the outlook for their patient could be bleak. Rob's about to undergo CT scans and X-rays to determine the extent of his spinal injury.
It's quite a significant mechanism of injury, so it's ideal really for the hospital staff to be able to see what's happened on the external side so they can get an idea about what's happened internally. If good to road traffic, and generally it's quite good for them to take the helmet. Although obviously, as you can see from the top of the helmet, there's not a lot of damage, it doesn't necessarily mean there hasn't been quite a big impact.
The next few hours could change his life forever. On the outskirts of Harrogate, paramedic Pete and the fire crew are attempting to safely extract an injured driver from his wrecked car. He left the road and ploughed into some trees. The team suspect a spinal injury.
For your information, we're just going to take the back seats out now. All right, Martin, so there's going to be a little bit of noise and banging behind you, but it's all something that we have to do, OK?
Fire up the toll, Steve.
Yeah, somebody talking to
They must get him on a spinal board and bring him out horizontally to avoid further injury. But there's a tree wedged against his door, so the safest way out is backwards.
We've removed the door from the passenger side. We've also removed the tailgate. What we're intending to do now is, now we've removed the back seats, is to lower the seat for the driver and then stretch the casualty out the back.
OK, guys, you can lower it. Right, can we get to you guys just sort of at our shoulders to get the head and we'll bring him down?
This is going to be a delicate operation.
The bridge is going to be quite awkward. Yeah. Depends how far back they can get him. He's lying down now. I don't think his feet are on traps.
That's it. Good man, Martin. You're doing really well. Right, Martin, now we're friends. We're going to grab onto your legs, OK? Yeah. 1, 2, 3, slide. Rest.
You've got him down there.
Same again. On slide. 1, 2, 3, slide.
This procedure is slow and careful for good reason. If Martin has damaged his spine, any sudden jolts could cause permanent damage and paralysis.
Rest there. His right elbow is just ajar on the plastic.
Gonna carry on with slide, OK? 1, 2, 3, slide. OK, that's it. OK, one more. Is everybody ready?
Yeah.
On slide. 1, 2, 3, slide. Brilliant. OK, guys, thank you. There we go. I've got him there. Somebody come and feed in there. Brilliant. And down. Perfect. OK. Nice and still. Lovely. Okie dokie. Let's get some blocks on you, just because you've had a bit of a do. You're not quite sure what's happened.
Martin was travelling back from a weekend away in the lakes. Now he's facing possible surgery to his back or neck. But his injuries aren't his only worries.
Can you pass me my phone, please, yeah?
Your what?
My phone.
All right, we'll sort that in a minute, yeah?
All right.
We'll sort it out, don't worry, mate.
Relax for now. Let's get you in the ambulance and we'll get everything sorted.
Time in a flight.
Right still.
May I put it in my pocket?
No, I'll sort it. I'll give it to you in the ambulance, okay?
Don't worry, we're surrounded by coppers, mate. No one's going to nick it. Steady, steady, lift. Marvellous. Your feet first.
He'll be taken by land ambulance to join Natalia at the nearby Harrogate Hospital. This might be a life-changing accident for both of them. Scans on their spines are already scheduled. The James Cook University Hospital in Middlesbrough covers some of the UK's most rugged countryside, the rolling moors and isolated dales of North Yorkshire. For many of its patients, it's an hour's drive or more from home. And today on the helipad, paramedics James and Andy have an urgent mission.
Yeah, the details are a bit sketchy, but it's somebody semi-conscious after a tractor versus slurry pit accident.
Slurry pit?
Yeah, you're going to get covered in shit.
The accidents happen just 20 miles away as the crow flies. Local paramedics are beating the chopper, but they're a 40-minute drive from Middlesbrough.
That's road we're topping. Oh yeah. I've just marked that, so we're waiting for that to start with. Roger.
Pilot Steve Wardby will have his team at the isolated farm in 10 minutes.
Sounds quite serious. Concerns about airway. We've been semi-conscious. Just that's the first thought that goes through my mind. We'll see when we get there.
Rosedale is a tiny community surrounded by the high hills of the North York moors.
No obvious wires my side. Thank you very much. I bet you've got a bit of a slope actually. Unless you're right by the gate.
No, we'll go right up there.
Yeah. Got wriggly tin sheets there, guys. Just watch that for me.
Yeah, seen.
99 landed.
Claire Dring was driving a tractor when it careered backwards through the wall of a barn. The cause of the accident isn't clear.
How are we doing?
For some reason, we don't know whether there's been a sort of an episode at the wheel or whatever.
Yeah.
But it's rolled backwards. It's gone through that low wall there, which has destroyed it. Taken the end of the wall.
The tractor came to a rest just feet from the slurry tank.
There's the back of the cab, like a glass cab, which was missing, and it's possibly hit a head on some of the wood and the stone structure on the back of that, so we're thinking some form of head injury.
Claire is confused and lapsing in and out of consciousness.
When you say head injury, are we on about with lower GCS or...?
Agitation more than anything.
So probably about GCS 14 maybe.
Probably at the moment, yeah.
Okay.
Claire, nice and still for me, nice and still.
Tacky, ain't she?
Her heart is racing. Paramedic Andy suspects Claire has a serious internal injury, but it could also be caused by a head wound.
I think it's a tacky from that.
I just didn't want to...
Just going to bob a cannula in.
Nice and still, my lovely, you're doing great.
How did she get up here then? She got out. So she was unresponsive, probably had a bit of an LOC.
Very much so that he
So
said
this
he was
chap
dead.
was with her. I thought she was dead, so...
And out cold?
Yeah.
So she was in there, just laid like that, looking pale or anything, or...?
She's completely out.
Like I say, she's mobilised up here, hasn't she? Do you know when she got out then? Did you help her out, or did she just get out herself?
No, a battle indicator here.
Right. Can you want to have a look at it, mate?
The back of it's obviously out, but you can see where there's the wood and stone look like they've come into the cab.
That wall there, the wall's gone back with it. Bizarre. I don't know whether or not she's just lost it and then that's it dropped back at head, but there's some confusion at a minute as to how long she may have been unconscious. So we can only go on really what we're looking at. So.
She's not complaining of being in any pain, is she?
No, not at all.
No.
It hasn't from our around.
No.
Claire, can we just ask you yet again, have you got any pain anywhere? No. No pain, okay.
Her confusion and lack of visible injury are making the assessment difficult.
Yeah, mate.
All of this is
The only
just to
injury
make
we
sure
can
you
see
keep well,
is there's some bruising to the left side of her face.
Left side, this just there,
where
isn't
my
it?
hand is.
Sort of
and the
temple
cheek
area.
as well, yeah.
Left temporal zygoma area.
It's a perplexing case.
Bring her down. All right. Let us know when you're ready, mate. Just keep your arms in. All right.
But there is a further clue.
constantly had this right-hand gaze over to this way.
Weird, isn't it?
Her head is twisted to the right and the gaze has always been to the right.
Her constant glancing to the right could be a symptom of a brain injury.
Just there. So we've got a bit round here, haven't we? A bit of a lump there.
What is clear is that Claire urgently needs X-rays and brain scans at James Cook. Helimed 99 is going to be heading back to Middlesbrough.
You're doing a good job there. Excellent job.
The air ambulance is always a welcome sight on the moors. It means the local medics can stay to deal with the next emergency, rather than wasting time on the long drive on poor roads to the trauma centre.
Hi, it's Andy on Helimed 99 again. Now, we're wondering whether she's had a bit of a do while she's been in the tractor, or she's got something going on post-incident. Oh, probably about 10 minutes. All right, bye. Bye.
Paramedic Andy is hoping diagnostic tests will answer the many mysteries surrounding this case.
She could have had a fit, she could have had some cardiac event, which has caused her to lose control. Or it could be a mechanical failure of the tractor. Got a fast pulse, which is a bit unusual. If she's had a fit, you could have a fast pulse. A bump to the edge, you could have a fast pulse. So something's not quite right.
Claire is now minutes from intensive care.
Ready, steady, slide.
She's X-rayed and a head injury is ruled out. But she has lacerated her liver. She undergoes surgery and after 4 days is fit to return to the country. It's been a lucky escape.
Hello, ambulance service. Is the patient breathing?
It's midwinter in North Yorkshire, and Helimed 98 is heading up to one of its most famous landmarks, a huge chalk horse carved into the side of the rugged North York moors.
We're responding to a 67-year-old female who's fallen near the White Horse up in North Yorkshire. We've got a crew responding to back us up, as well as mountain rescue.
Running wind slightly from the left.
The patient's life is in real danger. She's lying in sub-zero temperatures, unable to walk, and a long way from a road.
Knowing the area as we do from obviously flying from Topcliffe, it is quite steep. So to try and get reasonable access to this lady might be quite difficult. So it might be a bit of a trek down a hill or up a hill, whichever we may find when we get there. Some of the white horses down south are really old, aren't they? They're kind of prehistoric. But I've got a feeling the one at Sutton Bank is just like 50, 60 years ago somebody decided it'd be cool if they had a white horse. There's a bit of graffiti, that's what you're saying, basically, yeah.
We've got rain ahead, guys.
For paramedics Paul and Al, this is a routine mission made risky by the weather. Helimed 98's heading for a storm.
Icing. Ice forming on the...
quite a bit.
It's so cold, the rain is freezing on contact with the chopper.
We'll come down. That's outside areas +1.
If the ice is allowed to build up, its weight could cause Helimed 98 to crash. Pilot Steve must get out of the rain fast.
We're in descent now. We'll get ready to clear of this. You can see the ground there now. There we are, we're just about to come out now.
It stops as soon as it started. But the same freezing conditions are making this rescue even more urgent.
There we are, casualty, 2 o'clock. Visual, yeah. We'll land on the top and
go down.
On the top and come down. How are we doing? Mate 2 just arrived at patient side now.
The team's patient is a veteran walker, stranded on a treacherous footpath along the edge of the moors.
A minute. You normally fitting well? Yeah. So you've not been knocked out, you can remember everything that's happened to you? Yeah.
Judith Moore is in agony and dangerously cold.
We were coming up the bank. It was slippy, so we were taking our time. I was leading, and I slipped and fell back onto my wife. She hit the ground with me, and I must have fallen on her leg.
Yeah. So you see something more around your knee, is it?
Yeah. It's like, yeah.
Yeah.
I wonder if you've dislocated your knee.
Paramedic Paul diagnoses a broken leg and a dislocated knee.
Judith's basically come over as her husband's fallen on top of her. She's unable to move her knee as it is at the minute. I'm wondering whether it's more dislocated than that or anything else. She's really cold, so we could do doing something to keep her warmer. That's why I popped
So if we get the Flectalon on the path, just get her into it, and then we'll get her sorted.
How are you feeling?
All right, just cold.
You're just cold, I know. We've got a nice big thick sleeping bag there for you, Doug.
Priority really is to insulate her, because the air temperature is probably only about 4 or 5 degrees, and when you're laid in contact with the ground and not moving, you lose a lot of heat, so you get very cold quickly. That's what you like. Where are you from?
Hartlepool.
Oh, they're all tough up there, aren't they? Yeah.
Nice to see you, sweetheart. Just try and twizzle around on your bum. Give me both your legs.
Stop.
Okay, right. All we're going to do now is just turn you that way. It's perfect. Now just relax back.
They're wrapping Judith in the Flectalon. It's a fur-lined bag designed to lock in heat.
Right, sweetheart. You'll soon warm up. All right.
How are you doing?
Ground paramedics have trekked more than a mile along the clifftop path.
Hello, love. This is my old pal here now.
The other boys on the way down.
But there aren't enough people to carry Judith up the slippery bank to the chopper safely.
100 metres to the top,
well,
and the MRT's on the way.
Yeah, that's what I'm saying, they're on the way back.
Yeah.
They're going to need mountain rescue, but the weather's worsening and the temperatures are plummeting. High on the edge of the North York Moors, walker Judith Moore desperately needs help.
I'll come inside.
Just sit on it now. Just sit on find a black bit and sit on it.
A mini tent will shield Judith from sub-zero temperatures.
You'll literally be scorching and you'll not know why you're so cold doing it.
Surprising how quickly you warm up once you get inside the shelter, although it doesn't look to be much. It traps all the body heat from everybody in it, so the more people can get in it, the warmer you get.
Can I just lift your sleeve up, sweetheart?
And it also protects you from any convection or losing heat to the surroundings.
Paramedics Al and Pete are waiting for mountain rescue to help carry their patient to the chopper.
Let's just whip this over so we can have a good look at what's going on.
They're giving her powerful painkillers. Her injury is agonising. And they need to straighten her leg.
Try and relax, sweetheart, as best as you can.
Nice long deep breaths, love.
That's it. Well done, Judith. Just try and keep your leg nice and relaxed. Well done, sweetheart. Nice deep breaths on that gas for me.
The team's impressed by her courage.
See up here there?
Yeah. You've done that really well there, Judith. You're right, she's hard. We've got mountain rescue coming out. Okay, so they're going to put you on their stretcher to be able to get you up a lot easier than having to carry you. All right, I think it's got a big wheel on it or something like that.
Oh, you're our ambulance.
Yes, love. We'll carry you up to the helicopter and we'll get you on board there. All right, Doe.
At last, mountain rescue have reached the scene.
Hi there.
Hey, guys, you all right?
Thank you.
Yeah, no,
Stretchers for you.
this is Judith. Judith basically had a fall. Husband's fell on top of her. She's then fallen down. I think it's a proximal tibia fracture.
We'll probably wait on a few more just to lift.
Yeah.
Slide the stretcher in.
Yeah.
Down. Clip up. Load and go.
That sounds good to me. You're the experts.
But the ground is lethal.
All right. Jump. Hey. Prepare to raise and raise.
Well done, Judith. Good lass.
And prepare to lower and lower.
They're going to use their specialist stretcher to carefully carry Judith 200 metres through the woods up to the chopper. The HeliMed team can call on 7 mountain rescue teams, all volunteers who turn out from home or work.
Fade in on the sides. Yeah, we'll do.
Without mountain rescue's help, this would have been a risky journey.
And we get to sunshine.
Judith's reached safety.
log a glider out at the 2 o'clock.
Bank radio, ahead of med 98, lifting and turning to the north.
Pilot Steve's anxious to get his patient to hospital before the weather turns again. And it's still making its presence felt.
Some hailstorm, look. Oh, big pieces as well, look. Wow. Won't be long, Judith, I don't.
Yeah,
Element 98, NS lifted, routing James Cook.
They are heading north, 20 miles to Middlesbrough. Surgeons are waiting to assess Judith's injury.
Elevator at Alpha, surface wind, 260 degrees, 11.
Thank you.
Judith's hill walking days may be over. Yorkshire's heritage helps drive a tourism business worth £6 billion a year. But there's one group of visitors who do more than most to bring history to life. For the born-again mods, the scooter is still king of the road, and parkers the height of fashion. Vintage shirts change hands for hundreds of pounds, and a restored Lambretta can cost more than a car. But news has just come in to the Topcliffe base that a rider has come off in bad weather between York and Harrogate. Pilot Steve Wardby and paramedic Kit von Mikwitz know that these cases can be serious.
I've got brains at junction 47. That's all to effect.
Yeah, thanks. I'm just going to go east left.
Oh, DCA there at 11 o'clock.
Ah, yeah, roger. Oh, yeah, he's on the bend. He's lost it on the bend. Right. We'll come down onto that patch there in the 1 o'clock.
Right, next to that puddle.
There you go.
Lead paramedic Paul is first out of the helicopter. He gets an update from local paramedics.
Hey guys, you alright?
Hey mate, you alright? This is Steve, he's come off his bike.
Okay.
He's got good air entry. I've got no radio, but I've got a carotid.
Steve, where's it hurting, mate?
In my back.
Right in your back? I can imagine, mate. So what's that pain now on a scale of 0 to 10?
10.
10? You can feel it crunching, can you?
49-year-old Steve Campbell's description is graphic and worrying. His restored scooter is badly damaged. The weather is atrocious. There's mud on the road, and he came off on the bend.
He did have a bit of blood in his mouth and he's got chewing gum which I've removed.
Oh, right, okay. No loss of consciousness and anything like that?
No, it says not.
Right, okay.
Steve was on his way to a scooter rally when the accident happened. The crunching sensation in Steve's back is called crepitus. It could mean he's displaced the bones or cartilage in his spinal column. The team will have to be very careful when they move him.
Steve, you know me fitting well?
Hey?
You know me fitting well?
Yeah.
Yeah? I think them stats are accurate, you know. It's a bit sad, isn't it? Stats are 84%.
The amount of oxygen in his blood is low and his skin is blue. The cold isn't helping. They need to warm him up.
I'm conscious he's going to become hypothermic soon if you're not careful, so we'll cannulate him at backup wagon. Unless he's under a lot of pain as we start rolling him, then we'll just reassess it. All right.
Right, Steve, what we're doing is we're just going to be putting a scoop underneath your back, all right?
This will be a roll and lift without pain relief. It's not going to be easy for patient Steve.
Steady, roll. All right, Steve.
Well done, you're doing well.
You're doing really well.
Okay.
It's just the board going under. It's just to get your, just keep your head still for us. All right. Okay, we're gonna roll back. Ready, steady.
Steve.
You're doing really, really well. All right. You're doing really well.
How are you doing, Steve?
Fucking painful.
I bet it is, mate. Just bear with us. The thing is, Kit, can you get some morphine drawn up?
Right, one last bump.
Fantastic. Right.
Put that on you.
He can now get the pain relief he badly needs.
What's wrong?
Where am I?
You're on an ambulance.
Ketamine is a powerful and effective drug, but it can leave the patient confused.
Right, Steve. You all right? What's wrong?
Scared.
You feel scared? You're on an ambulance now and we're going to look after you, okay?
He does feel some crepitus, some movement in his back. So obviously that's a big concern really, because if he has done anything significant, the more we move him, the more damage it's going to do, potentially. Right, Steve, I'm going to give you some morphine. Can you do me a favour?
Yep.
The cannula being on this side, can you just cut that other sleeve off?
No, not the jacket.
Sorry, mate.
No.
What's wrong? Is it your back?
No, the jacket. Oh, you're going to have to cut that off.
I'm afraid we did, mate. If we could have saved it, we would do, but that's least of his worries at the minute.
40-year-old, that jacket.
You just sliced it up.
And I've just cut it off. I've ruined his day, if it wasn't ruined already.
Oh, no.
Steve's going to be flown to the Leeds General Infirmary.
Oh,
We need to go further on, Kit, I think.
oh.
Has that done anything for your pain at all, that morphine?
No.
Nothing.
LS99 lifted to LJ.
His main injury is going to be his back. What he's done for that obviously depends on the X-rays when he gets the casualty. But we're querying the pelvis because of the mechanism of injury more than anything else.
During the flight, Steve's pain becomes unbearable. Paramedic Paul decides to give him more ketamine.
All is up to alright. He's still in a lot of pain, this lad, so.
LS99 landed LJ.
Steve's taken straight to resus to be examined by a team of specialists. Scans reveal why he's in so much pain. His back is broken in 3 places. Steve had major surgery to stabilise his spine, but serious complications meant he spent 6 weeks in hospital. He's now home and making a good recovery, but his scooter riding days are behind him. Judith, the woman who slipped on ice near Sutton Bank, was taken for x-rays. She had dislocated her knee and broken her leg. She was in plaster for 6 weeks and will need a replacement knee before she attempts any more hiking. Martin, who embedded his car in trees, broke 3 ribs and fractured his wrist. His girlfriend Natalia wasn't so lucky. She had to undergo surgery for a fractured neck, but is recovering well. As for mountain biker Rob, tests revealed he had also broken his neck. 3 vertebrae are now bolted together. But he's determined to get back out into the woods with his mountain biking mates. Only he's got a lot of recovery to do first.
Ongoing, I'm on physiotherapy to bring back my movement because I'd lost movement in my legs and strength in my arms. For the time being, the bike riding's out. Perhaps got to...
Some breathing.
He's struggling to breathe. Very seriously injured.
In some of the UK's most remote places.
Down the line and I'll tell you exactly what to do next.
There's just been an accident on the M1 motorway. It's on fire and it's gone into the railway bridge.
Your life is on the line.
How far did he fall?
About 5 metres.
He's intubated and ventilated.
You need some of Britain's most elite medics.
Is there any serious bleeding?
Yes, there is, yeah.
Can't feel legs, anything below my neck.
We're in a remote location in the middle of a woodland. They've broken their back.
The speed of the Yorkshire Air Ambulance can make the difference between life and death.
Your discretion, take off.
LS99 lifted.
Today, there's a desperate fight to save a tractor driver trapped up to his neck in a lake.
It's sinking. Push it with in. I need the picture off.
The team's called to a badly injured biker who hit a 200-pound deer.
He had no chance. He braked, came off, and that was it.
And flying Dr. Andy is forced to anaesthetise a patient in the street.
I'll give the drugs, bag her gently during that time. Okay, is everybody ready? Yeah.
From a tiny hamlet on the Yorkshire coast, reports of a serious accident are coming in.
Ambulance, is a patient breathing?
60 miles away in Wakefield, the man's life is in the hands of the 999 call takers at Yorkshire Ambulance Service headquarters.
He's stuck under a tractor in a corner.
Okay, tell me exactly what happened.
He's gone over a bridge and it fell off and he's stuck.
Even before the caller has hung up, rescue will be on its way. Air ambulance dispatcher Jane Stubley is listening in to the call.
He can't breathe and he wants to.
It's okay, sweetheart. We've got help on its way. We've got fire brigade. We've got everybody on the way, don't worry.
Paramedic Tony Wilkes is being scrambled to the scene.
Top quick is Tom.
Hey, mate. Just watch job 1845, will you?
Start the location. We definitely know it's trapped underneath it.
The details of the location are sketchy, but Helimed 99 is already on the way.
He'll be about 120.
Pilot Ian Musette will have Tony and Paul there in just 15 minutes. And they now know exactly where they're going.
Tango Alpha 195405.
1855, thanks for the mid-9 Smack bang in the centre of Withenwick.
The accident has happened on the banks of a fishing lake near the seaside town of Hornsea. Local paramedics have now reached the man, but he's in a terrible predicament. Every second counts. The trapped man is in danger of drowning.
Once we get there, obviously it's a case of trying to assess him while he's underneath the tractor. So it's quite a heavy piece of kit. So we need to obviously be conscious about moving him. He could have some significant major trauma.
Yeah, might be sticking life jackets on, Paul.
I know, I was thinking that.
Yeah, so water here at 12 o'clock.
Yeah, that's from 99 overhead scene.
Okay, clear left.
99 on the ground.
Hey guys. Hey, all right, love.
Groundsman Sam Brockwell's mini tractor plunged from the bridge, trapping him by the leg.
I've got a crew member trying to get bring in a collar and scoop
okay.
ready. I don't know what these guys are planning on doing.
At the moment, it's looking predominantly like it's the seat that's trapping him, but the seat seems to be supporting a lot of the weight.
Only his head and shoulders are clear of the water, and he's terrified. He's sinking deeper.
Is his left leg right up in air then? Is it?
Left leg's up there.
It looks like it's quite an acute angle, doesn't it?
Yeah. Right leg, he can move. That's not trapped at all. Right leg's quite free.
But that's under the water?
Yeah.
It looks like he may have a collapsed lung.
But when he's groaning, you can hear...
You can hear something? Right, okay. Possibly got some decreased air entry in his right-hand side.
Paramedic Paul knows Sam's life is on the line. If the tractor settles further, his patient will drown.
Look, it's sinking.
Right, listen, my name's Paul. All right, so we're going to try and get you out as quick as we can.
It's sinking. Push me further in.
Okay, mate. He says he can feel the tractor pushing him further and further underwater. Just bear with me, I know it's a bit awkward.
All he can do is give him painkiller drugs and wait for firefighters to work out how to lift the tractor without further injuring 32-year-old Sam. He's desperate to escape.
I need the picture off.
I know, listen, we've got to do this carefully, haven't we?
9-2.
Do you know what I mean? We can't just rush.
Lifting the tractor could crush Sam's leg further. They need to be careful, and it could take time. That's time Sam may not have. His temperature's falling, and he's showing signs of losing consciousness. Wildlife runs free throughout rural Yorkshire, and the king of the woods is the deer. It's thought that there are more now than in Robin Hood's day, more than 1 million animals nationwide.
And then turn Helimed at 98 upper.
In the skies over North Yorkshire, Helimed 98 is on the way to a bizarre accident.
Got a 50-year-old motorcyclist is hit an animal on the road. Motorcyclist is unconscious but breathing. Getting some more confirmation on what the injuries actually are.
Yes, obviously, no.
The team's heading for the market town of Helmsley. It's a mecca for bikers, out enjoying the winding B road north through scenic Billsdale to Middlesbrough.
We've been to this road many times in the past. It's an area of open road in the countryside that quite often both cyclists and motorists alike use the race up and down, so I'm not saying that's the case with this patient, but we have attended quite frequently in the past. Got the road, yeah. Got that cutout I was on about, yeah. You can see the road this side of the wood. You got two or three port vehicles. That's got a visual, yeah. Coming back, map, guys.
ADS from Helibed 99, visuals are seen, preparing to land over.
Yeah, I'll go in front of that police car. Oh, I don't know if I'll fit actually. We're going to have a look, if not I'm going to put it in this little field below us.
Pilot Gary is on final approach to a tight landing spot in the middle of the road.
Wires, I can't win that field, the green wires.
I think this red car's reversing, Gary. Still good mine. Just beside.
Banking. There we go.
Hi, you're right. A lot of pain. He's sort of posting his hip, whether he's got some confusion, head injury, hip pain, not sure at the moment.
The injured rider was thrown from his high-powered bike and slid more than 50 metres down the tarmac. He was wearing protective leathers, but he's still badly hurt.
He's a good colour, he's fine, he's a lot of pain. We'll get some oxygen on him.
The other casualty of the crash wasn't so fortunate. A fully grown deer crossing the road from nearby woods was killed instantly.
He can't have been going very fast, and he kept at this point and fallen ran out of the field. He had no chance, he braked, came off, and that was it.
There's 2 dead deer in here the last 2 days.
Locals are used to accidents caused by reckless riding on this road, but this wasn't that sort of crash. Kenny Best, the 59-year-old biker, was riding sensibly.
Kenny, just relax, fella, okay? Just don't move your head 2 minutes for me.
He's like MotoGP here on a weekend, and I never even heard him coming.
Kenny, we're going to take your helmet off, fella, okay?
Passers-by did the right thing, leaving the rider where he fell. Now paramedics Pete Valance and Lee Greenwood must remove his helmet. It's feared he may have injured his spine.
There you are, Kenny, just relax, Kenny, okay? Kenny, don't move, don't just...
Kenny's in severe pain. Lee is trying to make him more comfortable.
Is it pain in your pelvis? Or in your back?
Yeah, everywhere.
Pain everywhere. We'll start getting packaged up and stuff. That's it.
It looks like he's fractured his femur. The fear is he could be bleeding internally. If so, this crash could kill him.
Yeah, you can hear it. He's in quite a considerable amount of pain. It's quite difficult to assess him. It doesn't like he's got anything obvious that we can see. Just complaining a lot of pain around his hip and pelvis, so we're going to get some analgesia on board.
They must use a splint to prevent broken bone fragments damaging internal organs.
Kenny, just relax. Kenny, relax, okay?
Kenny's also been injected with TXA, a drug to prevent bleeding and encourage clotting.
Push it out and then literally feed round.
They're going to fly him direct to the James Cook Hospital in Middlesbrough. There was nothing he could do to avoid this crash, but its effects could have devastating consequences for him and his family. On the banks of a fishing lake on the Yorkshire coast, Sam Brockwell's life hangs in the balance. Trapped beneath his tractor, there are fears he could drown.
Are we aware of the panic? And then do the 4 bolts underneath that seat, get the seat out the way.
Okay.
We might be able to get him out after that.
Right,
so
okay.
I'm really concerned that if we start undoing the seat, it's going to fall further this way. If that fails, we'll just literally start lifting it and we're going to have to just get him out.
Okay.
Sam has a suspected broken shoulder and a collapsed lung. But paramedic Paul fears his patient's life could also be in danger from compartment syndrome, a lethal condition caused by toxins building up in trapped limbs. It can cause sudden cardiac arrest.
Can you feel me touching you there, Sam? Can you feel that? Yeah. Okay. Yeah, Sam. Can you get his ECG, Doss? We'll put on ECG, just in case he's throwing up some ectopics.
He's monitoring Sam's heart for spikes in the rhythm, ectopics, that could be signs he's going to arrest.
So you said last BP were?
We have got BP on him,
oh,
he can't get around to his arm, because he can't move his arm.
His pulse is growing weaker, and his blood pressure is dropping.
Let's just stick these on, Sam. Can you talk to me? How old are you? How old are you, Sam?
32.
32. Where do you live?
Hull.
Hull? Is there any pain in your tummy there?
No.
You've got there? Give him some TXA.
Yeah.
All right, because he looks quite trapped, so he could well have something.
Absolutely.
You know what I mean? So we'll give him some TXA as well.
Paul wants his patient freed quickly. TXA will reduce any internal bleeding.
Oh, fuck's sake.
All right, Sam, we'll get you out as soon as we can, mate. What's getting worse?
Just the weight.
I know, mate, I know.
The team's so concerned about Sam's condition, the second chopper, Helimed 98, is being scrambled. It's bringing a trauma doctor to supervise his care.
You'll be able to feel it moving as they're trying to tie things around it. Okay. The second they've taken the weight, we can get you out. All right.
All Paul can do is reassure Sam as the firefighters get to work.
You're doing really well.
Helimed 98 is arriving on the scene to join the rescue.
Any pain in your shoulder?
Yeah.
A lot?
I love a lot.
Tell me, you can get some morphine drawn up as well, mate.
Dr. Neil Sambridge will be in charge of resuscitating Sam if his heart stops.
Just give us a shout if you start stirring some ectopics up, will you, mate? If your heart starts going a bit funny, all right, then obviously I'll give you something to stop it. Okay. You're doing really, really well, mate.
At last, it's time to move the tractor.
Right, we're going to start taking some of the weight. Okay, and you'll start feeling a bit better.
Cables are now supporting its weight. They'll first have to remove the driver's seat.
Where's that? Where's that? Your shoulder.
It's feared Sam may be suffering from hypothermia. He's been submerged for an hour or more.
All right, well done, mate. Good lad. Anything on his ECG?
No, nothing yet. I've been watching it.
Good. Yeah, we're going to have to be careful with his strap around his shoulder. If we can get around his waist, because he can put his foot down on the ground, he's just slipping. If we can try and avoid getting something underneath there, if he's on his shoulder, do you know what I mean?
Sam's got to help himself. Firefighters have created space for him to move his leg.
Are you going to push up with your leg?
Yeah, I'll try.
Can you move that leg?
Yeah.
Would you be better putting your leg further down?
Wait, hang on a minute. There's no pain there in your pelvis, is there?
No.
Right, can you move this leg? Hang on a sec.
That's it. Go on, mate. That's it.
His shoulder.
Just watch the tractor as well.
All right, buddy. Go on, man.
Watch his arm. Someone support his arm for me.
If you can. Knee over that steering wheel. That's it.
Watch his arm.
He's out.
Just take board back.
One last push, bud.
That's it.
One last push. And 3, 2, 1, go. Go on, mate.
At last, he's free. Now the focus is shifting to his injuries.
We're going to have to get him off his bad arm.
If you just come up this way, then onto the scoop.
Yeah. I'm just conscious about his shoulder as well.
Oh, fucking Jesus.
Alex, can you just support his head for me as we go down, mate, please? Thank you.
Back, Sam. That's it. All right, mate.
Fucking hell.
There are fears he may have broken his pelvis, a potentially deadly injury that can cause fatal internal bleeding. But the cold is also a serious danger to him.
Got any blankets to wrap him up?
Get him wrapped up and out of here.
The race is on to get him to hospital. It's 20 miles away in Hull.
I just lift him as it is.
You sure?
Yeah.
All right.
For the fire brigade, it's been a very difficult rescue in an almost impossible location.
The main challenge was really securing the tractor so we can actually manipulate the casualty from under the tractor. It was the cold which was getting to the chap, and obviously we need to extract him reasonably quickly.
NS 199 lifted route in Holwell.
Roger, Steve, thanks.
An hour ago, Sam was cutting the grass around the fishing pond. Now, he's on his way to a major trauma centre.
Beside radar, Helimed 9 and Alpha laying down at Hull this time. We'll call it company attention.
A full surgical team has been assembled to assess his condition.
1, 2, 3.
Paul fears his patient may have many undetected injuries.
His right arm was bent right back behind him. His leg was quite an acute angle, so he could well have done a pelvic injury.
It will be a few hours before the specialists know the extent of the damage. For the air ambulance team, the day's weather forecast can be a matter of life and death.
In Leeds, in a minute ago, solar winds, 40 knots, gusting 24, all the nines.
Pilot Gary Brasher is briefing his crew.
A bit windy, forecasting 4,000 all day, and then again throughout the day, rainy and then heavy rain.
And it's not long before the blustery weather becomes a factor in a very serious case.
Is the patient breathing? The patient's bleeding, but she's bleeding profusely from her head.
On a rural cycle route near Ripon, a wet road was a factor in a crash that's left a rider fighting for her life.
Police say again, following with 93604.
She's come off the bike and pushed by.
Is she breathing?
She's breathing.
Element 98 Alpha leads, hello.
And I've lifted from Nostril 4 on board, routed to Ripon. Currently unconscious. I'm assuming there's some form of bystander help. We're at the mercy of the callers. Quite often when we get there, it's not always as we find it on the call. Element 98, can we have a hospital breakdown when you've got a few minutes, please? Closer to lead. Yeah. You enter with over. Yeah.
Yeah, I've got Harrogate at 12 nautical miles, LGI 23, Northern General at 27 nautical miles over.
Element 98 air desk, we are 1 minute to the scene. Is anybody already on the scene? Oh, we've heard from them.
Yeah, that's all received. There is an RRV keyed on scene, over.
Any clear left? I'll let you shut down, go, because I'm going to have to do a bit of climbing, I think. There's a gate, mate, on the left. Oh, is it? Oh, okay, I'll go out now, then.
A 62-year-old cyclist has a severe head injury. Paramedics Tony Wilkes and Paul Holmes know cycle accidents can be very serious.
Hi there.
Hiya, how are we doing?
She's come off the bike, rolled over. Daughter was behind her, saw her.
Okay.
But she's been semi-conscious since. She's withdrawing to pain.
Yeah.
Karen Coram is critically injured. She was riding down a hill when she lost control after hitting this drainage grate.
It seems to maxillofacial, round the jaw, round the nose, left eye closed right over.
Okay.
She's probably doing 15...
Did she have a helmet on?
Yes, she did. We're taking it off. She's doing 15, 17 miles an hour.
Okay, yeah.
Your verdict on injuries?
Potentially life-threatening.
Right.
Potentially.
Okay.
The accident was witnessed by a motorist. She's put her medical skills to good use.
I'm a nurse, so we have to stop and help when we can.
What happened when she landed on the floor?
She landed on her back. The bike flew out from under her. I rolled her into the recovery because she was bleeding quite a lot from the nose and mouth.
It was quite clear that she'd got quite a bad head injury. There was a lot of blood. So just worked with the first responder really to just turn her over and get her airways clear.
I take it all the blood's come from her head, has it?
All completely come from her nose.
Oh, from her nose?
I couldn't have a look in the mouth.
Okay. Is there much damage to her helmet?
Where's her helmet?
Her helmet did little to protect her face.
No, there's no damage to her to get off. I've been up, down her neck and her back and her pelvis again. She's not flinched.
Okay.
Karen, open your eyes. Just try and relax. All right, you can talk to me.
Well done.
Can you get suction at it? Oh, just a minute. Can you use your suction, mate?
Karen's having difficulty breathing, and she's not making much sense.
Just mouth, sweetheart. Just going to do a bit of suction, get me some of this blood. That's it.
Karen desperately needs intensive care. Her husband has driven to the scene.
Keep nice and still, sweetheart, just for a minute.
Still, my darling, still. They're going to roll you onto a stretcher.
The team has alerted the trauma centre 20 miles away at Leeds General Infirmary.
Steady. Lift and slide it on top of the gate.
Time is critical. The sooner she undergoes surgery, the better her chances of survival.
We've just lifted scene, routing LGI, ETA approximately 10 to 15 minutes over.
Both Paul and Tony have their work cut out, keeping their patient alive. Her blood pressure is dropping.
That pulse is getting even slower. I think we're going to take some atropine, I think. Element 98, our person's letting down LGI. Don't be a confliction.
Desk 98, finals for LGI.
The rooftop landing pad is a welcome sight for the medics. Her life is now in the hands of the trauma team.
This is Karen. She's in her 60s. She's a cyclist, came off round the bend, quite low speed, but she's gone face first. She did have a helmet on, face first onto the ground. Reduced GCS immediately. When we first turned up, there was a lot of blood coming from, looks like from her nose, and facial injuries more than anything else.
Neurosurgeons spot a bleed on her brain. They operate immediately to reduce the pressure. Karen is fighting for her life. For Yorkshire farmers, the local air ambulance is a lifesaver, and its crew, everyday heroes. Hundreds owe their lives to these choppers, and today, another farmer's life is on the line.
Top lift out, and made 99 Alpha, looking to lift outbound Gould.
Mid 99 Alpha, top of tower, tick of your discretion, steps in 0106, not still KP 1022.
Paramedics Pete Valance and Kit von Migwitz are being scrambled to a farmyard accident near the town of Gould. A man attacked by bulls.
Kit, what grid was it, please? It was Sierra Echo. Yep. 569 247, and it is right next to Eggborough Power Station.
Thank you very much.
99, information is patient now out of field and waiting in a silver car. RRV is just got on scene. Over.
Yeah, that's all received, thanks. We get called to quite a lot of farming incidents. We've had a lot involving cattle and certainly bulls over the recent years. So farm workers, they know the risk of it, but obviously working day in, day out with the cattle, there's always the chance something's going to go wrong.
99 Commander, situation update. Patient has chest injury, reduced fat and increased rest rate.
The accidents happened close to one of Yorkshire's 3 giant power stations. Pilot Ian Musette must find a way through a network of high-tension cables.
Got small wires this side of the river.
But there's another hazard on his mind.
Where's the bull? It was in a shed. Was in a shed, yeah. Rising ground to the front, Pete, you waiting for me to stop? Okay, I'll wait for you to stop. There's crew on scene in there. That is from 99, landed on scene, over.
Local ambulance crews have reached the farmyard first.
The bull kicked him in his bum area to the floor, and then it's proceeded to kick him in the chest and head. Headbutting, sorry.
Farmer Tom Lancaster is lucky to be alive. His chest was crushed by an animal weighing close to half a ton.
What's this going out of 10, pain-wise?
I've not asked him, to be honest, but knowing him, it'll be that'll too, because they're hard on farmers.
Tom was feeding his herd of young bulls when he was knocked to the ground and trampled. Neighbours found him bloodied and badly hurt.
He was actually bent down, so he didn't see it, and it hit him up the bum. Bolted him up the bum, and then, of course, it knocked, and it's been hitting him on this side. Not just once, apparently, it's been hitting him a lot.
Bulls are often bred for beef. They grow faster, but they're also more aggressive than cows.
Is it normally bad-tempered then, or you just cut it on off day?
Cut it on off day.
Oh, yeah. So you can recall everything that happened?
I can, yeah.
And you got yourself up and walked out here?
He knocked my phone out me on 3 times.
Yeah. So he were in a bad mood then, yeah.
Well,
yeah. So we'll get our trolley out, we'll put it outside here, and we'll ask you to step out nice and steady, and then we'll just try and get you down and keep you as still as we can as we go round.
His farming neighbours are shocked by the attack.
I've known Thomas for 22 years and I've never known him be hurt like this with cattle. He's worked with him all his life, you see.
Pete fears Tom may have a neck injury and he could be bleeding internally.
Keep your head still, there's brew on roof. Is that for crew? Right, bring this leg round and to the floor for me, that's it. Before we move anyway, just stand a minute. Okay?
Just stand around a minute.
Where's that hurting?
Can I have a quick look at your back? Is that okay?
There are clear signs of the attack on his back, but no sign of bleeding.
Big bruise, left shoulder, left chest. Same on the right, just there.
All right, if you come towards me, Thomas, and then turn round, okay? We'll just get you sat on edge. You might feel it tilt a bit because it's a rigid board.
They're going to strap Tom to a spinal stretcher.
Happy there, yeah?
Right, we want your feet down this end. It's not your best shirt, is it?
It was.
No, go on, we might get it off then. I'll take...
We've ruined his jumper. He wasn't happy about that.
Yes.
Keep your head still,
Can just help spin you. If Pete helps you from behind, I'll help you with your legs here, and we'll just do it all in one, okay? Are you ready? Super. Oh, even better. There we go.
Oh, a little blanket.
Only now is Tom showing signs of pain.
We can get a bit more pain relief, is that still not?
A bit more.
I won't prop it up. You just pull it on there.
Right, just bear with us 1 minute. Let's give you a bit more pain relief.
Oh, no.
Let's get this morphine in. That's great stuff. Got Thomas settled in a fashion. He's got what looks to be some rib fractures. He's got quite extensive bruising across his back as well. So we don't know if there's any other internal injury yet taken place. He's fully alert and his obs are good at the moment, but initially his oxygen saturations were low, hence him being on oxygen and us taking precautions, immobilising him. So it sounds like the bulls had 2 or 3 goes at him and caused what could be significant trauma.
The team's flying Tom to the major trauma centre 20 miles away in Leeds. But their patient isn't keen.
He absolutely hates it. He won a helicopter flight and he's never used it because he just absolutely hates flying.
Into the hover, turn right, clear area departure, all happy?
Air desk from 99 lifted for LGI. He's had a significant injury occur. We need to make sure there's no underlying damage that might deteriorate later on. His breathing is now improved.
Element 99 Alpha, new QNH is 1024. 1024, thanks, Element 99 Alpha.
Tom is already booked in for scans and x-rays at Leeds General Infirmary.
Okay, 1024, that's 500 feet, that's good. Coming on down. Here we go. Down with the bomb.
It's taken just 10 minutes to fly him from farmyard to the heart of Yorkshire's biggest city.
Does your breathing feel any easier?
Feels a lot better.
Does it? Apart from where your ear's bleeding, you've got no pain around your head at all?
No.
What did you think to your first flight then?
All right.
Your mates were saying he'll never get in that, he don't like flying.
I said I won't win anything.
I think it's a bit late now.
Bye.
Even if the results are good, it could be some time before Tom is fit to return to his cattle. Helimed 99 is fighting through low cloud, heading for the Yorkshire coast.
A bit of weather on the way there, guys.
Their mission is critical. A woman's life is at stake.
Roger, update from scene. The patient is GCS3, over.
Okay. And the weather's clamped.
Roger that, thank you.
The patient was found unconscious in her seaside garden. Local paramedics are rushing her to the emergency landing pad near the local Coast Guard station.
So it sounds like we're on the way to quite a serious call at the moment. We've been told that lady's fallen off a ladder with potential head injury, and that she's completely unconscious at the moment.
It's feared she has a brain hemorrhage. Paramedics John Baxter and Kit von Mikwitz know Helimed 99 may be the woman's only hope of survival.
The crew are reporting that the patient is peri-arrest. Prior to that, they were reporting that the patient was quite combative.
They're concerned that she's going to have a cardiac arrest, or that her heart could stop because her injuries are so severe. She could have the bleeding within her head or a different type of severe injury. We're making scene as quickly as possible now. Time really is important.
At least they're now through the low cloud.
Guys, they've got Bridlington, mate. Not the road crew coming down past the trees. Is that them? Yeah.
Yeah.
Got it.
They're arriving at the same time as the ground crew who found her.
That's 99, we're visual with the crew now, preparing to land. There's a height restriction on this gate at this side. Just have to get close and...
Yeah.
99 landed.
Oh yeah.
Linda Parsinson went out to trim a hedge in her back garden. Minutes later, her husband found her lying unconscious. She's critically ill.
Hiya, I'm Kit, one of the paramedics. What's the name?
What was it? Say that again. Linda.
Linda's agitated. It could be a sign of brain damage.
Pupils were pinpoint. Right. A little access in this hand. Lovely. So we've got another aircraft coming as well. We're going to probably be putting her off to sleep with an anaesthetic, emergency anaesthetics. In the meantime, we'll just try and get her as comfortable as we can and see what we can do for her. Okay.
All right. Kit wants to give Linda a powerful sedative. Ketamine will calm her down. But its use must be authorised by a senior ambulance service doctor.
Hi Steve, sorry to bother you, it's Kit, one of the paramedics on Handbid 99. We just wondered if you're okay with us giving something just to settle her down and if we can get her sats up a little bit and stop her being so agitated. Fab. Alright, thanks very much for that. I'll speak to you later. Cheers, bye then.
Bridlington is at least half an hour from a major trauma centre, but the most important part of that is coming to her. The 2nd Yorkshire Air Ambulance Helimed 98 is carrying a consultant who will be able to anaesthetise Linda before her flight.
Can you set up a kit dump for an RSI, please? Sir. John's setting up for an RSI, so as soon as they arrive, hopefully we'll be able to pop off to sleep.
Linda, relax, sweetheart.
All right.
2 helicopters, 8 paramedics and one of Yorkshire's most experienced trauma consultants are now focused on saving Linda's life.
Linda, can you squeeze my fingers for me? She's just making that constant groaning.
Hello Andy, how are you?
Dr. Andy Poutney is arriving to perform a high-stakes medical procedure that's risky even in hospital. Her survival will depend on its success. At the side of the road, in the seaside resort of Bridlington, a medical team is preparing to anaesthetise Linda Parsinson.
She'd been found at the bottom of a ladder. So we're not really sure if she's fallen, I don't.
It's less than half an hour since Linda was found unconscious in her garden. It's feared she may have a massive brain hemorrhage.
We're going to pop her to sleep in the street out there, just where it's a bit more easy.
You just grab a 20mm syringe, right, for us. We've got size 6, size 7, size 8 ET tubes.
The whole team will assist in the procedure called an RSI, or rapid sequence induction.
So John, are you going to be the assistant for this?
Okay.
Yeah. We'll actually go to the. Can we get the nasal O2 on if we can? Linda, okay.
Nice and relaxed, Linda. Well done.
I'll give the drugs. Bag her gently during that time. Okay, is everybody ready? All good.
Yep.
Everybody happy?
Yeah.
Linda's being paralysed with drugs, so they can take over her breathing.
Nice sats.
1 minute.
Thank you very much. Very good view of the epiglottis. Bottom end of the cord, bougie, please, thank you.
A tube is being slid down her windpipe. It's a difficult operation.
I'm happy that's through the cords.
And it's being performed on a footpath.
Thank you. Happy with the tube through the cords. Bougie out, please. Thank you. We've got a syringe here and we'll reattach it on. Thank you very much. Please have a listen for me. We've got good CO2 coming back and good sats at the minute still.
The team's successful. Linda's brain can now rest, but her condition is very serious. The race is now on to get her to hospital 30 miles away in Hull.
So we're not entirely certain what's happened to Linda. It's possible that she's fallen off a ladder and injured her head, which has caused bleeding, which is inside her skull, which is making her very, very agitated.
Ready, steady, lift.
Another possibility is that she's had a stroke or bleeding on the brain as a result of a medical problem, and that's caused her to collapse in the state that she is now.
Just leave this down at the side so it's there for when you're at hospital if you're going to use it then. So I'll swap this fluid over. Kit's done another, got another bag here.
Fluid bag, that'd be really helpful.
Is it this side, Kit? Yeah. Right.
Helimed 98 will have Linda at the hospital in just over 15 minutes. But even that might not be fast enough. It's uncertain whether she'll survive. On the remote Yorkshire moors, even a routine medical emergency can become life-threatening. And a child with an asthma attack is especially urgent. In the market town of Helmsley, a worried mum has dialed 999.
And can I take your name, please? Claire Williams. And are you Mum? I am, yes. I would advise you to try and use that inhaler now, okay? Okay.
Air ambulance dispatcher Al Day is listening in.
Are you sure that the help is being arranged?
This young lady's really struggling to breathe. Because we're so busy, the nearest ambulance is about half an hour away. It's only a 5 minute or so flight for the Topcliffe aircraft, although it is in the town centre of Helmsley.
40 miles north, Helimed 99 is being scrambled from its base at RAF Topcliffe.
About 070. Okay, mate. I think we'll find Helmsley, alright? Yeah.
9 and Alpha, technical for discretion, present position, surface from 20011, crossover vessel.
Barely. Good right. Tally.
Paramedics James Stubley and Andy Armitage know that in asthma attacks, seconds count.
I mean, an asthma attack can be serious in any age, become life-threatening. Time is of the essence, really, and particularly with paediatrics as well, because they can deteriorate very quick.
The right drugs could save the little girl's life. But in children, doses are critical.
2.5 minutes albuterol. Yep. We're doing anaphylaxis dose.
Same dose?
Yeah.
Helmsley streets are tightly packed, but the team know a landing place.
Yeah, 615836. He's talking about just there on the south side of the bridge. Is there any other resources on scene?
There's an ambulance showing 25 minutes away.
Helmsley on the nose.
Just 5 minutes after the call-out, help is circling the rooftops.
Well clear, left for everything.
NS99 landing.
Yeah, roger.
Over the bridge right and then a left.
Yeah.
There's no time to waste. The team undergo annual fitness tests for a reason.
What are you?
Mum Claire Williams is still on the line to the 999 operator.
All right, thank you very much. Thank you for your help.
It's an fire here for Ian.
I'm just in here.
Ruby is fighting for breath.
So, what's happened today then?
Well, yeah, I got a message from the childminder saying that she'd gone really downhill. So I went to pick her up and I noticed her breathing. She's working a lot harder with the breath.
Asthmatic and being a bit difficult with breathing, eh?
Yeah.
The family is used to coping with her asthma, but it's still worrying.
Finger. Can I put that in? You know what's coming, don't you? Can I put that on your finger, Ruby? There you go. See if we can get a good reading on that. And I'll have a little listen to your chest, okay? So normally she's on inhalers, she's taken them numerous times,
she's
not
on
worked.
Montolupast as well for her asthma.
Okay. Can I lift that t-shirt up? Is that okay?
Asthma kills 3 people a day in the UK.
Sounds all right, that. No wheeze. Her breathing's up a little bit, so normal for Ruby's age is say 20 to 25, and it's at 36, so that's up a bit. 3 temperature. Just goes in your ear. 38.2. I thought you felt a little bit warm. Her breathing is up, so she's going to need a check over, isn't she? To be honest with you. But I mean, normally a pulse rate would be around about maximum of 120. 148 at the moment. There's something going amiss, isn't there?
Andy suspects an infection could be at the bottom of this, and he wants to rule out meningitis.
You've not noticed any rashes on her body? We'll just stand you up. If you just have a look at her body, Mum. You have a look at front, I'll look at back.
Her numbers are a little bit raised, but not too concerned at the moment. She's obviously alert, she's orientating, interacting with us normally, so it's just a matter. She's got a temperature, so there may well be an infection somewhere, so we just need to try and sort out where that's going to be.
Ground paramedics have arrived after a long blue light run over the moors.
There's no rashes, so increased pulse, increased rest, and warm.
Ruby's breathing has improved, so it's decided she doesn't need to go to hospital.
So I think with it all in mind, probably just a check-up really. That's probably going to be the option, isn't it? With her being so young as well.
Claire's GP practice advised her to ring 999. Now Andy's satisfied a GP is the best person to treat her, and he's making sure she gets an appointment.
All right, doctor, thank you. Bye. Bye. There you go, Mum, I'll give you your phone back. About 5 o'clock.
For the Helimed team, it's time to return to base.
Engine controls, both to fly. Confirm flight, airwaves.
But the crew like nothing better than a patient who doesn't need their medical skills. There's good news too for Sam, the tractor driver trapped in a lake. Against all the odds, doctors found he had no significant injuries, apart from severe bruising. Kenny, the veteran biker who hit a deer, suffered a major fracture and was unable to walk for several months. Farmer Tom was off work for more than a week.
2.5 broken ribs and maybe some fluid on my lungs.
The ringleader of the attack is no longer in the herd.
I've looked after livestock for 60 years and they can just turn and get you. Bull went to Selby Market and they made top price of that day of what we sent.
Karen, the cyclist, spent several days on life support at Leeds General Infirmary and is still slowly recovering from a fractured skull.
Previously, if you hurt, say, a leg, you knew that within days it would be, you'd see improvement. But with this, it's been weeks, months.
And Linda, the woman found unconscious in her seaside garden, had no idea her rescue involved so many people.
I don't remember anything for the first few weeks. It's amazing how many people come together just for one person. It's, yeah. You feel slightly honoured.
A bleed on her brain was found to be the cause of her collapse, but she's medics.
Is there any serious bleeding?
Yes, there is, yeah.
Can't feel legs, anything below my neck.
We're in a remote location in the middle of a woodland. They've broken their back.
The speed of the Yorkshire Air Ambulance can make the difference between life and death.
Your discretion, take off.
Furthest 99 lifted.
Today, there's a high-speed crash. The driver is trapped, but one victim is missing.
We believe there may have been a child in the rear car seat.
A climber falls off Yorkshire's biggest landmark.
He's become unconscious. He's had some jolt on the back of his head.
The team call in the Coast Guard for a dramatic rescue. And a cyclist takes a tumble in the middle of a moor, with painful results.
He's landed right on that rock. Keep still, kids, keep still.
It's mid-morning in Leeds, and a lorry driver's dashcam is about to capture a devastating accident. It's a 40-mile-an-hour limit. The hatchback is doing 80. As the white 4x4 reverses into a drive, the black car smashes into it. Inside the 4x4, the female driver is trapped. The occupants of the high-powered hatchback, capable of 150 miles per hour, appear to stop to help. But then they simply walk off, leaving their victim, who is seriously injured. 5 miles away on the rooftop helipad of the Leeds General Infirmary, Helimed 99 is being scrambled to her rescue.
Just ready for altitude.
Paramedics James Stubley and Andy Armitage have few details of the crash.
What is it we're attending, please?
Yeah, it's an RTC, 2 cars with a patient that's trapped on it.
Wires as you come round. Yeah, visual. We'll go just the other side of that and let him go slowly down towards the road from there.
It's happened on a main route into Leeds.
No, visual. Well, I need somebody to close that road off, really. Yeah, no. Policeman coming up to clear the road now. Yeah, he's doing it, yeah.
Air ambulances have strict limits on the size of landing sites.
Over the domestic side. Thank you.
And this is big enough.
Down to the rear now. I'll be good there, guys.
It's a road traffic collision, dual carriageway, so a bit of speed. And we've got somebody trapped apparently, but we'll see when we get there.
Tracy Scadden is 32. The damage to the cars shows the force of the impact.
Hiya, you alright? How are we doing?
Alright. Tracy.
Tracy.
Tracy's got a nice little head injury. Laceration to the forehead.
Laceration to the forehead, yeah.
Lots of sensation down the left side of both the arm and the leg. Today she feels numb.
Feels numb.
It's feared Tracy has a serious spinal injury as well as the head wound.
It looks like it's been quite a significant impact. Approximately 80 mile an hour is what's being said. The car's done at least a 180 from where she's been going in a driveway, so it's a significant impact.
5 milligrams of morphine at 10:24. All right. That's one done as well. Tachycardia 119.
Yeah.
Blood pressure at the moment.
Tracy's heart is racing, her blood pressure soaring, and she's complaining of numbness down one side of her body. And now there's more worrying news from the police.
Hello.
Apparently there was a child in the child seat in the back of it.
All right.
In that house. I've only just found out, so that's right.
Oh, all right, okay, that's him. There was a child apparently in the car. What's in the house?
In that house.
Do you want to have a look, mate?
Thank you.
In the confusion, no one realised Tracy's daughter had been taken in by relatives living nearby.
That's 99. We believe there may have been a child in the rear car seat, and we'll get back to you about that one.
Tracy's wrapped in a plastic shield designed to protect her as firefighters cut her free.
All right, Tracy. You've had better days a bit, haven't you?
The rear end shunt means Tracy's airbag didn't go off. Now it's a danger to her and her rescuers.
Would you like some more morphine? Yeah. We just need to be steady with you though. Were you banging your head and that, all right?
At least there's good news about the other victim of the crash.
I've just been in and checked over the little girl and she appears to be fine, but obviously because of her age, what we'll do is we'll get the crew to run to the local ED and Grandma will accompany her up there while we obviously can convey Mum.
Firefighters are starting to cut her car apart.
Just watch your foot, mate, with that.
Right, we're ready to lift it.
At last, Tracy can be freed.
How are we doing? Yeah? We're going to get you out in a second, so we're just going to put a board down the back of you. Right. Are you the same as what I asked you a couple of minutes ago? Yeah.
The numbness she's complained of could be a sign of a spinal injury.
Yeah. I've got control, mate. Yeah.
Okay, right, well.
We're just changing over back.
Get rid of that headrest first, I think.
Tracy's back will be kept rigid throughout her rescue.
Hey, Tracy, you just feel this board going up back of you, all right? You know, you complain of that loss of sensation. We just make sure you've not done out to your back it out like that, okay?
Nice and steady, go with it. Go with it, let us know if it's hurting.
As far as you need to go, guys.
Back as far as we can.
The loss of sensation down her left side is just one symptom worrying the medics.
Does your breathing feel okay? Yeah? Can I have a feel of your belly? Does that feel okay? Yeah?
The pressure's come down now.
It's come down how much?
110, 74.
Their patient's blood pressure is dropping. She could be bleeding internally. She's going to be flown to the LGI. It's just 20 minutes since Helimed 99 left its landing pad.
They look clear all round. Still clear left. Clear to the rear.
They're leaving a scene of devastation on one of the main roads into Leeds, and a major police hunt for the occupants of the black car. Cars aren't designed to withstand the kind of impact Tracy's experienced. Her daughter's escape was down to luck and modern safety equipment.
Massive impact to back in car. It just goes to show that a good strong car and a good car seat nowadays does its job and reduces the risk of injury. Paramedics 99 Alpha finals LGI. Paramedics 99 landed LGI.
Tracy is being taken straight to resus for scans and x-rays, and the first focus will be on her spine.
It's not normal to have a loss of sensation. I would probably expect him to do a CT scan.
The accident could change her life. Malham Cove in the Yorkshire Dales is a prehistoric waterfall that was once bigger than Niagara. Now its limestone cliffs are an extreme playground for climbers, testing their skills on a huge 260-foot high rock face.
Ambulance service. Is the patient breathing?
He's making some noises like he's breathing, yeah.
50 miles away, reports of a serious accident are coming into Yorkshire's ambulance headquarters.
And is the patient conscious?
He's not conscious.
Right.
A climber's badly hurt and in serious danger of falling again.
999 desk job for you. It's Malham Cove. Someone is unconscious, fallen 10 metres, head injury.
Helimed 99 is his only hope of rescue.
Copy, traffic, Helimed 99 Alpha lifting, departing to the southwest Malham Cove.
Paramedic James is the leader of a mountain rescue team in his spare time.
I reckon about 4 miles from this high ground.
He's responsible for finding the patient today.
If you're looking at the cove, it's the east side.
On
and
the
you're
right.
near the top of the cove.
The cove is one of Yorkshire's biggest natural landmarks, and James knows it well.
So we've got Malham, that's Goresdale Scar, so that's Malham. What we'll do is we'll approach to the left-hand side of the ledge.
They're touching down in a lethal landscape.
NS99 on the ground.
The grassy slopes above the cove lead to a sheer drop with sharp boulders below. Paramedic Paul Holmes knows this terrain can kill.
It looks like a bit of a precarious position, so we need to be careful, making sure we're not going to actually slip and cause ourselves an injury. We've got mountain rescue en route, so we'll have to wait and see when we actually get a bit closer to the edge exactly where the patient is, but it's a bit treacherous underfoot at the minute, really.
You're in my territory now.
Can I give you this, mate, yeah?
Jeez. I've got short legs, you know. Watch yourself, mate, alright?
It's safer on your ass.
Yep.
Cheers, mate.
Unwary visitors have died after slipping on these slopes.
Fucking hell.
There's nothing between them and a 200-foot fall.
Fuck me.
Their patients lying in a precarious position on a narrow ledge.
Hello guys, how are you doing?
Victim and rescuers are one trip from a fatal fall. There's no obvious way of rescuing their patient.
It's going to be quite a complex evacuation.
And all the possible methods involve a lot of risk. Trapped on a ledge on Malham Cove, climber Rod Coles is in pain and confused.
Between 50 and 60 years old.
Okay.
He's dropped about 10 metres, virtually flat out. Got a laceration to the head. Bigger problem is between his shoulder blades to his lower back is where the most pain is.
Okay.
Although he's losing concentration and he's also struggling sometimes to remember what day it is.
Yeah.
Age and stuff like
We got told he was unconscious for a while, is that right? Yeah, how long for?
5-10 minutes.
Can I sit to the side here? Okay, we'll get you sorted. Alright, can you remember falling? No. Can I have a quick look at that? It looks dramatic. Can you keep it on there, mate?
Crow Andy, Helimed 99.
Search dog Andy, passing message over.
Yeah, search dog Andy, Helimed 99. We're on the ground above. We've actually just arrived at the patient now. Going to be quite a complex evacuation from here. I suspect we're going to need, obviously, stretcher and ropes over.
So if I just press down the back of your neck, is there any pain in the back of your neck?
A little bit.
A little bit. Centrally, or is it to one side?
It where you've said.
Okay, no problem.
The working environment's not ideal. We're on steep ground, so as well as your own safety, we've got to be kept mindful that kit's obviously going to drop below. We've still got people climbing around us, and then we're going to have to somehow get him onto a stretcher, a loaded stretcher, either up to the aircraft or down for us then to relocate. So it's going to be quite a big job, this.
James is concerned that one accident could lead to another.
Is it just worth tying him into something, just so we don't all go? At least a couple of us, I'm
I
conscious.
think we should be all right, yeah.
Well, at the moment, that girl's probably holding him up, and if she slips, what's stopping you guys from going? But we're all in quite a precarious position. Everyone seems quite capable in this position, but if somebody slips, we just obviously want it as a bit of a backup, so We're just going to tie him in.
The team want to protect Rod's neck, but the slightest movement here is fraught with danger.
I don't even think we're going to get this on, to be honest.
Can you lift the chin, maybe?
The thing is, we don't want him to move his head, do we, really?
Yeah.
You know what I mean?
Rod's head wound looks superficial, but his growing confusion is very worrying.
What happened?
We've had a bit of a tumble, I think, off the rock.
Right.
Okay. I think you might have got a bit of concussion.
No idea.
Okay.
What happened?
Nice. Fell off while you climbed.
He's getting a bit repetitive.
It's becoming clear Rod has several injuries, any of which could be life-threatening. He needs an immediate evacuation, but that won't be easy.
I think the plan is to probably sledge him down on a stretcher down into the bottom of the cove. So that's plan A at the moment. I'm sure B, C and D will come into it at some point.
How are you doing, Rob? All right?
No, my back's starting to ache quite a bit.
It will do, mate. Do you know, I don't know what's up with your veins, mate.
At last, local mountain rescue experts have reached the scene.
You all right?
They're equipped to lower Rod down the rock face using ropes.
How are you doing?
Good, thank you.
Definitely slow and steady as opposed to anything in a rush.
But it could worsen his injuries.
What do you think about getting the Coast Guard in and taking it out the top?
So I'll leave it with you guys, really. I mean, we can request that anyway if need be.
Because the smoothest will be up and out.
Yeah, oh yeah, without a doubt, yeah.
Even minor medical treatment is difficult to deliver safely, and Rod's showing signs of deteriorating. James is being forced to reassess the rescue plan.
He's got no altered neurology, but by the time he gets down there, if he has got an unstable fracture, he may have.
It's a smoother ride up if we can get him out.
It'll be clearer.
You know what I mean?
They're calling in the Coast Guard to winch Rod from the cove. 3 emergency teams, including £20 million worth of helicopters, are now on a mission to rescue Rod.
We'll need to clear every bit of crap out of the way because it'll blow.
I'm going to say it'll blow us all to smithereens.
The quaint towns and leafy lanes of North Yorkshire make it the perfect place for a romantic getaway. But today, it's the backdrop to a serious car accident.
No slide this.
Hi, Dave. We're just running on 1680. Apparently we got 2 trapped on this one.
The victims of the crash aren't sure where they are. It's up to pilot Steve and paramedics Adi and Pete to find them.
Body left and cross number 500, visual 1 in, ahead of 99 Alpha.
The crash has happened near the famous White Horse on the edge of the North York moors.
We're going through a little bit South Helmsley called Sproxton for a road traffic accident. Now, we don't actually show it's in Sproxton. It says come from the general area of, so it could well be that that's just the nearest mobile phone mast that's pinged the 999 call.
There's your incident now, 12:30.
Yeah, I've got the DCA approach.
The team find the accident at the same time as ground units.
Oh dear. Edison 99 visual scene there. Also got visual of the DCA racing to it, over.
A car carrying an elderly couple has rolled over, hitting a dry stone wall.
I'm going to put you in the field this side of the broken wall.
Broken wall of the cliff.
Bill and Ruth were on a break to celebrate their golden wedding. Now they're trapped. A passing GP stopped to give first aid.
This is Ruth.
Hello, Ruth.
Bill.
Hello, Ruth. Hello, Bill.
She's only on statin. She's on simvastatin. She's got no other health problems.
So roughly, do you know what injuries we're dealing with at the moment? It looks like they've hit that wall, hasn't it?
Yeah, turn sideways on. Double turn.
Yeah.
She has a head injury. He's in shock.
Can you get a... Do you want a collar? Yeah, get a dressing pad first of all as well. Let's have a look at that. Right, so that's oozing a bit.
And she's complaining about pain at her back.
Yep.
Behind her ribs.
Okay. So what's happening with this gentleman over here? He seems quite moving back. Can you have a look with him? Cheers, Eddie. Hello, Ruth.
Hello.
How are we doing, love? Let's have a look.
Sorry, sir. This is Bill.
Whereabouts in your back?
Hello there.
And your side.
Ruth could be describing a spinal injury.
First of all, let's have a quick feel of your neck, all right? Have you got any pain when I'm touching you there?
How are you doing, Dave?
All right. He's got his lamp cap on the side of his face that he hasn't had before. Trapped to his aim, which we think is the glass.
Yeah.
But no other pain anywhere else.
Okay.
How do you want to take this lady out of the car? Do you want the roof off or...?
I think at the way we're looking at the moment, where we should be able to just get her out the door because we've got the door moved right over there, so we'll be all right on that one.
I'm sure everything will be fine, okay? All right? You're very welcome.
The local GP narrowly escaped the crash.
I was coming down the road and this car had to pull in to actually avoid me. And as we went past, luckily we didn't collide at all. I saw in my rear view mirror the car overturned a couple of times and hit the wall.
How old are you, love?
77.
77.
Elderly people are more likely to be permanently disabled by a road accident. The team's worried about both of their patients.
Ooh, where's that hurting? So is it your hip down here? Is it down here, my love?
Paramedic Pete fears Ruth has broken her femur or her pelvis. It's a common injury for elderly motorists.
Ow. Okay, that works. All right, well, I've got my hand ready. Any pain when I'm pushing you on there? How does that feel, Ruth? Not so bad.
After a lifetime of driving, this was Bill's first accident. All he cares about is his wife.
Such a lovely man. And such a careful driver.
Well, he's obviously not. He's obviously just one of those things. What actually happened then?
All right then.
You've got a right big whacking. You're gonna have a big bruise on your head though. Yes. You look like you've been cage fighting. So I'm just going to pop a little needle in your arm. It basically means if anything starts to hurt that we don't know about at the moment we move you, I can give you some painkillers, all right?
She's got a big hematoma and lack to her head, just because of the head injury in her age, and there's some sort of force. We're going to fly her to James Cook.
Yeah. You come round here, Rick. I'll guide your legs.
Yeah, I've got.
You all right, Ruth?
That's it, you just lay down. We've got you.
You got your head?
Ready, steady, move. That's enough.
They'd booked this break as an anniversary treat. Now she's leaving him for a flight to hospital.
We all ready? Ready, steady, lift. There you go. Yeah. Okay, you all good? So she'll need to go in feet first.
Bill is being driven to the trauma unit of the James Cook Hospital in Middlesbrough. Ruth will be there first.
Lucky the pair of them.
Very.
Out there.
Very lucky indeed.
Had a 99 lifted heading James Cook over.
She's right. She's a 77-year-old lady. She's been thrown around at probably best part of 40 miles an hour in a car while strapped down to a seat. Looking at the amount of blood and the amount of hair that's stuck in there, there's every chance that could have actually gone through the bone and that could be a nasty infection risk.
We're clear of the light station.
The couple hoped that this would be a happy day in the countryside to celebrate 50 years of marriage.
99 on the ground.
Now Ruth faces several weeks in hospital, and she could need surgery. Bill's condition, too, is unknown. On the treacherous cliffs of Malham Cove, paramedics James and Paul are waiting for a Coast Guard rescue chopper to winch their patient to safety. The team's clinging to a steep slope above a 200-foot drop.
We're going to get the Coast Guard aircraft to come and winch you, so we do need to try and get you as comfortable as we can.
Right.
Just excuse my hands a minute.
My back is really starting to go into spasm.
Right, okay.
Climber Rod's pain is getting worse. He has powerful arms, and his fitness is making it hard for Paul to get a cannula into his veins.
Come on, this is ridiculous.
Without a needle, they won't be able to give Rod the strong painkillers he needs.
You've got veins like rhinoceroses have.
What happened, Roman?
Hey Rob, you took a fall.
Yeah.
You slipped. Yeah, and then you took a fall.
Oh, come on, this is... I'm getting frustrated with myself now, Rob.
Yeah.
But Paul's forced to give up.
Right, plan B.
Rod will have to make do with an oral form of morphine, usually given to children.
Right, open your mouth and...
There's concern his condition is deteriorating.
Yeah, what happened?
You fell off while you were climbing, Rob.
He's repeating himself, and that's often the sign of a serious head injury.
He's had a helmet on, so a helmet and still become unconscious. It's quite a blow. The way the rope apparently has caused it is basically caused him to flip down that way and obviously bang the back of his head. So he's had some jolt on the back of his head.
What's the timescale? What's the plan now?
The plan is you can have a little ride in a helicopter.
Vacuum mattress alongside him. We'll transfer him onto that. You happy with that move? If we bring him, yeah? All right, you need to trust us.
Yeah.
All right. We won't drop you, I promise.
It's a delicate task.
So what we're going to do, fella, we're going to swing your legs around, we're going to pivot you on your bottom. All right. You're going to be all right holding him, supporting him there. Keep your head nice and still as best you can. You all ready on the vac mat, guys?
One wrong move now, and a fatal fall could be the result.
So we're going to lift your bottom up. Keep his leg mate as well. Okay. Can you slide him down a bit more, mate?
Yeah. Where's that? You back? I know, mate. We'll get it sorted.
Everybody on the back mat ready? Yeah. Ready, steady, lift. We're just going to put some air back in that and then we'll mould it round. You should be a bit more comfortable.
Are you wanting this split pin in?
Yeah, there's a little arm that comes up and then just clips onto there just to keep it.
Oh, does that go on there first, is it? Oh, okay, yeah.
The team's going to evacuate the cliff face for the Coast Guard chopper that's been called in from its base 60 miles away.
We need everybody that's not needed on here to go. All right, thank you.
So that all these lot going down?
All these are going, yeah, because we need to get rid of all this kit. We need to get it all tied down.
No, I've not done the job yet with the Coast Guard.
Seriously, when it comes, you'll have to put your visor down, everything, it'll blind you and it's just deafening.
The rescue helicopter weighs 10 tons and is big enough to airlift entire ship's crews.
What a job.
Its downwash is enough to blow a grown man off his feet. Malham Cove's a major tourist attraction, and Rod's rescue is being watched by hundreds of visitors. The winchman's aiming for a ledge barely 3 feet across. But thanks to the skill of the Coast Guard crew, Rod's rescuer is now by his side.
Yeah, James Paul's patient.
Basically, he's fallen from that ledge just below that tree. Okay. Fell backwards, got a head lack on his left-hand side. It stopped bleeding, but it was immediate LOC for about 5 to 10 minutes. Right. Very repetitive post-incident.
The plan is to pluck Rod's stretcher from the rock face and winch him directly up.
Well, what we're going to do is I'll go up to the casualty onto the top. Yeah. Sit in the field, you can bring your aircraft back in.
Okay.
But the cove generates unpredictable turbulence and updrafts, and it will be a difficult, dangerous operation.
Rob, we're just going to take this sleeping bag off you now. It's going to get really drafty. The winchman's going to be with you all the time. We're going to see you on top, all right?
It's time for the medics to leave the danger zone.
We're going to make our way back up to the top of the to Malham Cove. The winchman's down with him at the minute. We're going to brief clinical handover. What we're going to do is we're going to meet him back up there. They'll lift the patient from here and take him back to our aircraft, and then we'll take him to LGI.
Rods dangling from a cable thinner than a man's finger. The stretcher is swinging in space 150 feet above the ground and yards from the sheer face of the cliff. This takes supreme skill. Thankfully, the Coast Guard team have it. They train to rescue people from ships in raging seas. Paul can't resist a souvenir picture. The expertise of the Coast Guard team is now about to deliver Rod back to safety.
Everybody ready? Ready, steady, lift.
Rod has coped well with his hair-raising rescue, but he's becoming subdued, and his confusion continues.
Off that, mate. Yeah, we'll put that outside if you're all right with that.
It's a worrying sign.
Clear and normal 560 on the fuel. Roll.
He's being flown to Leeds General Infirmary, 30 miles away.
Med 99, depart the area, KSY lead, thanks.
It's feared he has a serious bleed on the brain. The fall could still leave him with life-changing injuries, or worse.
Ambulance, is the patient breathing?
999 controllers must rely on information given on poor phone lines.
It's a very bad area for signal, so you can't get much out here.
From people often in distress.
He's just been knocked over by a car.
And sometimes what sounds like a serious case turns out to be relatively minor.
How's her breathing at the moment? Is that still normal? All right, take care, bye-bye.
It's a summer's afternoon in North Yorkshire, and a hayfield has become an emergency helipad for 2 air ambulances responding to a crash on a country lane. But it's not as serious as it sounded. Helimed 63, the neighbouring Great North Air Ambulance, will carry the patient. But 15 miles away, in the purple heather of the North York moors, another man is about to be in greater need of an air ambulance. The accident didn't look too serious, but Sean Farrer landed on a boulder. He's in agony and finding it hard to breathe.
Keep still, kid. Keep still. Keep still. Keep still.
His mates are dialing 999.
He's landed right on that rock.
Paramedics Tony and Paul are being diverted.
No, I'm seeing.
I've got another job coming in at the moment over at Gothland, up on the moors.
And it's someone come off a mountain bike, difficulty breathing, and a note's just gone on. They will not get an ambulance to where he is, so I will need someone.
We've just got another incident given to us on Gothland Moor in North Yorkshire. Apparently somebody's come off the mountain bike with difficulty breathing, possibly a chest injury. So we're just going to get ourselves together now and get off to Gothland Moor and leave 6-3 with this patient.
Don't tease, Helimed 99 Alpha. Helimed 99 Alpha, nice message. 99 Alpha, we're cleared on that task. 6-3 Alpha will be running with it shortly, they'll give you a call, but we're now diverted on towards Gothland, requesting a basic service.
No, I've just spoken to the caller. They've got a good signal up on the top of the moors. The actual grid isn't far out. Sierra Echo 830 985, over.
Yeah, Roger, thanks, Dave. Obviously.
Having a grid reference means the chopper can fly straight to the patient. Finding someone on the vast expanse of the North York moors can be tricky, especially when the heather is out.
Don't tease, Helimed 99 Alpha, shortly let it down to the east of Gothland. We'll call again, I think. I think it's on that rise, yeah, on the nose. Be on a track, I'm guessing. Is that somebody there with red top? Yeah, Sally.
Edis 99, visual with the patient about to land. Got a little crop of rocks just underneath you, Chris.
Yeah, I'm just looking.
It's rough terrain. Tony's helping pilot Chris land.
Yeah, right skin's good.
Okay, guys, we'll stop here.
Sean's still in great pain. He and his mates were on a day out from Leeds.
I've landed on that with my ribs.
With your ribs?
On his right hand side, there's a hole in his jacket and bruising.
Okay. So you've landed on your front?
Yeah.
Okay. Right, so you come over handlebars, landed on your front, rock under your right chest. Have you got any pain other than...
my ribs.
Right.
Suicide.
Any pain anywhere else?
Just breathing.
Okay. I don't want to cut any more off than I need to do, mate, but this one's cut anyway, isn't it?
Tony's patient is showing worrying signs of a collapsed lung, and it looks like he could be bleeding internally. Time is not on his side, and the clock is ticking. It's 20 minutes since mountain biker Sean Farrer did this on a moorland track. His mates are surprised by the apparent seriousness of his injuries.
He's obviously lost it. He's gone over handlebars, which wouldn't be a problem because there's heather everywhere, but he's landed, one of the lads pulled the rock out, but he's landed on a big rock on the side of his ribs and not done himself any favours, really.
You normally fitting well? Yeah. Got no allergies to anything? No. Okay.
He's not the first rider to fall victim to the treacherous tracks of the moors today.
We set off with 8. First downhill we hit, went over handlebars, and we think he's broken his wrist. He's sat at pub now in Leversham waiting for us.
Okay, mate.
And then we've done 7.5 miles and we've lost another one. So, I mean, there's still 4 of us left, isn't there? Yeah, still plenty to go at, so I'm sure we'll be all right.
Okay, right, buddy. Just relax your head back. We're just going to roll you onto your back. Are we all ready? Ready, steady, roll. Let yourself come over.
The team's taking no chances. They're treating Sean as if he's broken his neck and injured his spine, as well as his chest.
He's in a bit of discomfort from lying on the rock, so we'll give him a bit more morphine, which should take about 15 minutes or so to start having some effect.
Sorry, bud. This is going to be uncomfortable. All right.
That's my cough.
Right, well, don't cough then. Right, Sean. So once you've had this extra bit of morphine, okay, we'll get you fully strapped up. We're going to get you in a sleeping bag properly, and then get you onto helicopter out at cold. All right.
Time is of the essence. The sooner Sean is x-rayed and scanned, the better.
I'll phone James Cook first, make sure they're happy to take him. I'm sure they will be.
He's going to be flown to the major trauma unit in Middlesbrough, 20 miles away.
Just get you on, Sean, then we'll give you some more morphine, mate. Yeah. We'll get you off to hospital.
His mates aren't exactly sympathetic.
He don't have to cart his up.
That's it, yeah, we've got a cart to bike, haven't we now? It's us that want the sympathy, I think, isn't it?
Guarantees, Helimed 99 Alpha's lifted from near Ghostland en route for James Cook. We'll call again closer in.
Paramedic Tony is optimistic. Sean's blood pressure and other vital signs are holding up well. But the impact was very severe, and no one can be sure.
The main concern initially suggested that his breathing's been fine. All his observations are in normal limits. He's obviously been in quite a bit of pain and discomfort. The morphine settles that down, so fingers crossed he'll be fine. But any chest injury always gets us sort of slightly worried initially because obviously that's affected breathing.
Guarantees, Helimed 99 Alpha shortly loading down James Cook. We'll call again in a bit.
Injury-wise, he has got some bruising down his sort of right chest wall, on his upper abdomen as well, and he's got localised pain all around there, including right-sided chest cum, upper abdomen problems.
Sean won't be leaving the James Cook Hospital until a battery of tests is completed, and the results will prove the team were right to take every precaution with his care. A critical illness can make Yorkshire's hills a dangerous place to be. High in the dales above the village of Grassington, a man has collapsed with chest pains.
Hi, it's Pete on Air Desk. Hi, AD. They're still trying to track this guy down. It is Grimwith Resbit Sounder. He says it's about 4 miles away from Path.
It's definitely Grimwith Reservoir?
Yeah.
Helimed 99 is being scrambled from its base at Topcliffe, 25 miles away.
Basically, same track as before, Steve.
Yeah, there's Grimwith. Top of tower, Helimed 99 Alpha lifting, departing to the southwest.
Header 99 lifted 1190.
That's received. It does sound like it's more an access issue. Query CVA, query cardiac cover.
It sounds like a walker has had a stroke or heart attack. Paramedic Pete and pilot Steve must find him on the moors below.
Did he get a rough grid, or is it just Grimwith Reservoir?
I've got a grid reference for the reservoir, so it could be anywhere in the vicinity.
Oh, good. All right, well, we know where Grimwith is anyway.
Yeah.
The patient's having chest pains. His life could depend on the team's eyesight. Ground paramedics are hiking to the rescue.
They've headed about 1 mile to 2 miles to the west on the bank in there.
We are aware elements attending, so hopefully someone will look out for you.
There's someone in a red jacket on the corner by the trees on the nose, Steve.
Yeah, visual.
Pete's eagle eyes pick out 3 people on the banks of the reservoir. Help is now seconds away.
Have you got visual on scene of it?
That's a Roger, prone to land over.
Paramedic AD will take over the man's care.
Are you all right sitting up? Or do you want to lean against the wall?
Can you shuffle yourself over here, John? George, isn't it?
George.
George Ray was on a day out walking when he asked other ramblers for help.
As we just crossed each other's paths, he said, do you know where the nearest hospital is? And we said we don't really know the area that well, and he just fell to the floor.
Right then, George. Are you normally this out of breath? No. Can you give me a big smile?
AD is testing George for the telltale clues of a stroke.
As best you can.
His smile is thin.
You grip my hands and squeeze really tight. Go on, try and break my hands. Really tight.
But his grip is strong. The signs are pointing to a heart attack.
Try and stay as still as you can. I'm just going to take a quick picture of your heart, so still you are, bet the picture. All right.
George is being wired up to an ECG machine. Not only will it help AD pick up the signs of a heart attack, but if George goes into cardiac arrest, it'll allow him to shock his heart back into rhythm.
Very exciting on there. There's nothing really acute showing on your ECG.
But the tests draw a blank. It's looking like George's collapse was caused by an illness or a minor cardiac event.
Right then, George, the plan of action is we'll fly you to the ambulance. Right. Okay. Yeah. And then they'll take you to the local hospital. The local hospital doesn't have anywhere that we can really land. Hello, is that Karen?
Getting all mixed up.
Hello, my name's AD. I work for the ambulance service. We've come to see your dad, and don't worry, he's okay. He's at Grimouth Reservoir.
Grimouth, yeah.
He's been out walking and he's had some chest pain, which we've dealt with, and that's kind of gone. So he's not having a big heart attack or anything like that, but he does need to go to the hospital to see the doctor and just have some investigation.
There's the DCA now. Got it.
There's nothing to match air ambulances for speed, but paramedics will find it much easier to monitor George's condition in a road vehicle.
Just watch out for any sails or masts which are out and about. Yeah. Tent at the far end there. Yeah, got it. Alright, I'll just come to a little low hover here and then we'll reposition to the car park. That'll be fine there.
George is off to hospital in Lancaster for tests. They eventually revealed the cause of his collapse.
Consultant came, gave out tests and stuff, and he said, basically, I think you've had a small heart attack.
George is now on the mend. As is Tracy, the motorist trapped in her car after it was hit by a high-powered hatchback outside her home. Police are still investigating. Climber Rod's dramatic rescue from Malham Cove could have saved him from lifelong paralysis. X-rays in hospital revealed the extent of his injuries.
After the fall, I had 2 fractured vertebrae, a fractured thumb, and quite bad concussion.
He's just glad he wasn't alone.
Climbers end up in remote areas all the time, and we very much rely first of all on ourselves to look after our climbing partner or whoever's with us, and other climbers and other walkers and mountaineers. There's no question that you'd help someone else. Whatever you were doing, you drop everything to go to help them.
Sean, the mountain biker who landed on a boulder, was found to have 3 broken ribs, a collapsed lung, and 2 lacerations to his liver. He's recovering.
Feel legs, anything below my neck.
We're in a remote location in the middle of a woodland. They've broken their back.
The speed of the Yorkshire Air Ambulance can make the difference between life and death.
At your discretion, take off.
FedEx 99 lifted.
Today, the team's been called to an industrial accident after a factory worker loses his arm.
Where's the other part of his arm? I don't know.
Ice puts the skids under an elderly motorist and his wife is trapped. And a man's fall from a famous Yorkshire landmark is witnessed by his wife and daughter.
Why do you not listen?
Hello, ambulance service. Is the patient breathing?
He's struggling to breathe.
Tell me exactly what's happened. Breathing.
Okay, I've called an ambulance earlier. I've got a job for you.
This happens more than 1,000 times a year at the Yorkshire Air Ambulance bases. The mission is to be in the air within 2 minutes of the scramble siren. Speed saves lives in this business. And even when they've just delivered one patient to a trauma unit, if another case comes in, they must be ready for takeoff at any moment. And today, at Sheffield Northern General Hospital, that's exactly what's happened.
Okay, no, it is, mate, yeah. It's an industrial site, yeah. Okay, mate. See you in a bit. Cheers, mate.
Pilot Gary Brasher and his crew are being scrambled to a bad accident 10 miles away.
We go about
the job?
Yeah, I've got the grid.
We've just been alerted to another job in Mexborough in the local area, Rotherham. Possibly a traumatic amputation, so obviously we're just going to make up quickly now and then get on his way there. More details will get in flight, so...
just control switches.
Fly confirmed.
Both are flight, airwaves off, clear left. We'll be there in 5 minutes.
Yeah.
380.
Roger, thanks for a quick turnaround.
Paramedics James Stubley and Paul Holmes are on their way to a factory where a worker has had an accident with a shredding machine. An ambulance crew are currently working on him. It's unclear why he had his hands near the machine.
Bit of confusion whether it's the whole arm or just the hand and lower arm of it.
No.
We just need to remember to bring both bits with us from this.
Yeah.
Body parts can be reattached even a few hours after injury, but there are often complications.
There's significant potential for blood loss, so we're going to do as most to try and save the limb, but it just depends on the degree of the severity of the amputation. There's obviously clear potential for infection as well, which then cause problems further down the line. Ambulance down low, 3 o'clock.
They're on final approach, but it's a built-up area.
God, that's a bit of a friggin' nightmare to land, isn't it?
It's too dangerous to go into the yard. Gary chooses a nearby playing field instead.
Bag blowing away, one going up.
Yeah, it's going through the disc, I'm happy.
Airbus 98, apologies on the ground.
55-year-old Tony Davison is still in the back of the ambulance when Paul and James arrive. His arm is bandaged and he's stable, but it's a devastating injury.
The crew's done a good job. It looks like he's amputated it from around about there, so his hand's obviously missing, but he has got obviously part of his forearm still left. So it's just above his wrist, I think.
A combination of shock and nerve damage have kept Tony's pain levels surprisingly low. But Paul isn't taking any chances. He'll be administering the strong painkiller ketamine.
So we're enjoying some ketamine up, which is obviously a bit of a stronger analgesia than morphine and paracetamol. Give him some of this. It's not actively bleeding at the minute, so we've got a catatonic and the crew's done a good job of sort of stopping the bleeding. So we're going to give him this, get him on board the aircraft and convey him back to Northern General.
Understanding how it happened, what medics call the mechanism of injury, will be important information when they get to the hospital. There's also an important unanswered question.
Where's the other part of his arm? I don't know.
Even after a thorough search, the missing hand and wrist is nowhere to be found.
We'll just take it over that way a bit, Dave. Put brakes on, and we'll scrape him. It's easier for us to transport him on scoop, that's all.
Yeah.
So what have you been doing then, Tony? What do you do at work?
All sorts.
Found loads of stuff, Teddy's.
Yeah.
How long you work there for?
This new place, we've only got 15 months.
Oh yeah?
Just like we haven't been there that long.
Just relax back with
We've only been there since before Christmas.
And it may be a while before he's there again with this injury.
Okay, ready, steady, go. All right, mate. Once we've got him settled down, sorted out and wired up on the aircraft, we're going to fly him to Sheffield Northern, obviously the regional trauma centre. The team's ready waiting for us. So once we've got there, they'll be able to quickly give him assessment and then get him into whatever treatment course they need to do.
Engine control switches. Confirm. Confirm both at flight airways stun or off or whatever you want to do. Yeah, no.
The race is on to rush Tony to surgery.
NX98 lifted sea en route in Sheffield.
But his injuries are extensive, and the prospects for rebuilding his arm look bleak.
What they've described is that mid-forearm has been, it looks like it's been shredded from what they've described, rather than an actual clean amputation. They have described that it is still attached.
If surgeons can save even part of his hand, Tony's quality of life will be much improved.
Specialist people at the Northern General, that's the best place to take him to, so if there is any chance, then he's going to the right place. It's amazing what they can do, but it just depends once they've done a full assessment here with the specialists.
An ambulance awaits their arrival in Sheffield. In the next hour, Tony will find out if part of his hand can be saved, or whether he must learn to adapt to life with only one hand. Every day's an early start at Helimed headquarters, and there's no argument who's in command of breakfast.
When you're a pilot, particularly a helicopter pilot, you have to do a lot of things at once, a lot of complicated tasks all in one go. And making a good breakfast requires you to do something quite similar, because you're juggling all the different things. You've got things in the oven, things on the go. Oh, we're nearly there. Cooking on gas.
Pilot Gary is an army veteran who insists on a great British breakfast to set his crew up for a day saving lives.
It makes sense, really. If anybody's going to make the breakfast out of the crew, it should be the pilot, because they're going to be the best at it.
But 30 miles up the road, on the edge of Ilkley Moor, someone else's morning has had a terrible start. Reports are coming in about a serious fall on the huge boulders known as the Cow and Calf Rocks.
How far did he fall?
Probably about 5 metres. He hit his head.
Is there any serious bleeding?
Yes, there is, yeah.
And I have a split from base 4 on board, route into Ilkley Moor on task as the basic servicing cleared through the zone. We're on the way to Ilkley Moor, to the quarry just behind the Cow and Calf, well-known sort of rocks on Ilkley Moor overlooking the town of Ilkley. This chap's fallen, has a head injury. We don't know for certain he's a climber. It might have just been a walk. A member of the public got too close to the edge and slipped. It's a little bit loose in places, so people do tend to have mishaps there.
Down the line, I'll tell you exactly what to do next. I'm going to tell you how to stop the bleeding, listen carefully to make sure we do it right.
Pilot Gary's been there before. The accident has happened in a disused quarry.
Your options are either on the top, Gaz, or down on the bottom near the car park. I've landed there before. There's a crossroads of a track just outside the quarry. You can land on. Yeah, you might get in there. That'd be good if you could. Otherwise, on the top's the probably next best option. Yeah.
Paramedic Al's a part-time mountain rescue leader. He knows the area well.
I don't think you'll get in that quarry, but yeah, can. Loads of room. Ooh, challenge. Oh, there we go. Challenge. Red rag bull and all that. That was it. The heavy thud of the gauntlet being thrown down. I will.
Gary wants to land as close as possible to the patient. This is one of Yorkshire's most popular tourist attractions. Landing could be tricky.
It's gonna be heaving. And all them cars. So there's people on the ridge. Do you want me to open the door and move them on? I don't do it. They're all tied together. Are they really? Yeah. They're on some sort of... they're not criminals, are they? Right, last time I landed just here and it just worked out right. Looks okay this side, guys. You happy with the slope and your blades at the front? Yes, mate. Yeah, okay.
Visitor Rob Anderson has a serious head injury. Okay. Mountain rescue members are on the scene.
We were called from the bottom with our first aid kit. He's fallen down, hit the middle edge, hit the bottom ledge, so probably 15 foot in all.
So he slipped and bounced a couple of times.
Bounced twice. He's got a good 4-inch gash in the top of his head down to his skull. We haven't cleaned it in any way, we've just put that on to try and stop the bleeding. But as you can see, he's bled quite a
You've
bit.
been knocked out at all?
Doesn't remember being knocked out, but he's got a bit of memories.
Was I knocked out?
We don't think so.
Just keep your head still.
Climbers saw him fall.
As I turned around, he was rolling down the embankment and landed straight on his head. He was conscious, but yeah, obviously he was bleeding quite badly, so we just grabbed some tissues and things and tried to stop the bleeding.
His wife, Melanie, is distraught.
You've not fallen as well, have you?
No, no.
Well, there's no need to cry. He's going to be fine. He's just bumped his head. He'll be all right.
Falling in love.
Don't worry about it. He'll be all right.
Sit down here next to him, yeah.
Oh, bless.
You're all right, mate,
Yeah, I think so. Thanks for your help.
Listen, thank you.
Just keep your head still, sir. Just look towards me.
It's been a terrifying experience.
He just kind of like lost his grip, and I was.
There was nowhere grip to hold on to. That was the problem.
Yeah, were you going up or down?
Down.
Right.
Stupidly down.
Thank you.
Oh, man.
Oh, Rob, honestly.
What were you thinking?
See, what were you thinking?
Rob was on a family outing when a lapse of concentration on the rocks led to a fall that could easily have been fatal.
Who's the Prime Minister?
A simple question does little to reassure Rob's rescuers.
They tell me.
It's a sinister sign.
That is odd, isn't it? Don't tell me.
Al's beginning to suspect a serious brain injury. His patient needs an immediate flight to the trauma unit in Leeds. At the Yorkshire Air Ambulance's northern base at Topcliffe, winter has the team in its grip. It's -5.
Today's weather, it'll be bitterly cold and struggling to get above freezing for much of the day.
And paramedic Lee Greenwood knows from grim experience that accidents can often be weather-related.
There's lots of patches of ice. These roads don't thaw out, and we could be called out to some unfortunate drivers this morning.
Ambulance service, is the patient breathing?
Been an accident just outside my house. There's a car turned over.
Okay.
It's Old View, Leavening.
Okay, is everyone conscious?
Yes, there's somebody inside hanging up by the seatbelt.
Right.
Could you send somebody out straight away?
Okay, we're already getting the help arranged for you.
It takes less than an hour before Lee's instincts are proved right. The emergency call comes from the bottom of a notoriously steep hill in the Yorkshire Wolds, a rolling range of hills east of York.
Linton down, good morning, Element 9
In the small village of Leavening, a couple in their 80s, along with their son, are trapped in their car. Paramedic Tony Wilkes knows this could be a difficult case.
It's like how else with each job. Sometimes they may be trapped, physically trapped, or sometimes they might be just trapped just because they can't get out because the door's stuck or something. So for these jobs, it could be really serious, life-threatening indeed.
Fire and ambulance teams are at the scene. From this location, there's going to be a choice of 2 hospitals they can fly the injured patients to.
Yeah, Roger. York showing at 12. Nearest trauma centre, Hull at 24.
Got the blue lights. Right, get vision to the scene, on the nose, in. Got it? Yep.
The Wolds are one of the hilliest areas in the county, and the slopes that seem to have contributed to the accident are now presenting a problem for pilot Ian Mouzette. The helicopter has to land on flat ground.
The one field there is, it's got a heck of a slope on it. Yeah. It's 3 o'clock now, Ian. Like there's a little outhouse. The muddiest one. Yeah. It does look wet.
When a soggy sloping field with nearby power lines is the best option, the final decision to land will only be made after a close inspection.
Just bear with me a second.
As the helicopter hovers inches from the ground.
Tell you what, we'll bear. Tony, do you want to get out here?
I will do, mate.
Right.
There's some Element 99 now. We're on the ground.
It's really foggy down there. It's all right, mate. Spend his life walking through mud. Yeah, so just making his way to scene. There's obviously an ambulance response vehicle here, and an ambulance has just turned up. So just get a quick handover from them.
They've come down the hill. It looks like they've sort of lost control and sort of right at the side of the wall, which has just rolled the car over.
The 80-year-old driver has managed to get himself out of the wrecked car uninjured, along with the man who was travelling in the front passenger seat. But Elizabeth Carroll is in the worst state.
Liz, I'm just going to have a look at your ribs, okay?
She has severe pain in her chest and neck.
He's fine with that's all I've been told.
Firefighters are cutting out parts of the car to make way for a spinal board.
Start sliding the board under the second, my love.
The size of the car and the way Elizabeth is lying is going to make it difficult to get her out.
It's not going to be easy, is it?
For Tony and the other paramedics, the solution is often a combination of dexterity and manpower.
Right, I'm stuck on clothing now, Mike.
The main priority is to protect the spinal column and head.
Got it.
Elevated.
I can't.
There's a plenty of hip pain in here with the seatbelts coming in.
It hurts like hell.
Pain under this bit.
Even a shallow breath is hurting.
A shallow breath is hurting.
Is it where you're putting your hand?
Yes.
What about your tummy?
Oh, that's all very uncomfortable, actually. Everything's uncomfortable.
Shout step coming up, sweetheart.
Why?
Just so we can give you some pain relief. Make you a bit more comfortable, that's all. So you're probably going to have to trip to the hospital to see some of the doctors, okay?
Yeah.
Okay. The important thing is you remember everything that happened, don't you?
No.
You don't remember anything that happened?
What do you mean? No. I don't remember the accident.
You don't remember the accident, do you?
No.
Elizabeth has appeared lucid for most of her ordeal, but her memory loss means she may have a brain injury. She's going to be flown to Hull Royal Infirmary. It's a moment of relief for Elizabeth's rescuers. Many of the firefighters are local part-timers, and this has been a tough rescue.
A modern car, great safety features, but all cars present different issues and problems. Got all-time and retain appliances from Mold 2 appliances that use various cutting equipment, stabilisation equipment to extricate the casualty.
We might need a few firemen to give us an hand because it's like a quad mile up there.
It's time for Elizabeth to say goodbye to the local paramedic who's been by her side throughout.
Elizabeth, I'm going to leave you with these lovely flying boys now. Okay, you take care. Enjoy the flight.
Routine to Hull Royal Infirmary and climb 1,500 feet.
The trauma unit is already on alert for their patient's arrival. Elderly people are less able to recover from major injuries and more likely to develop complications. Elizabeth's will be a complicated case, and the next 24 hours will be critical. Back at the Cow and Calf Rocks on Ilkley Moor, the team's patient is causing concern for paramedics Alan John.
Don't worry about it, it's all right. Very good, I think. A bit concussed into. Probably should have board him, shouldn't we?
You can't remember that the Prime Minister's David Cameron, which I wish I couldn't remember as well, but I can.
Rob's head wound is through to the bone.
So I can see the skull there. It doesn't look like there's any... You're
going to be sick of it.
It's all right.
Al is making light of the injury.
I'll stop talking about your skull.
But it's potentially very serious.
It's starting to hurt. My head's starting to hurt a bit.
And Rob's new symptom is very worrying.
Did it hurt when you...
No, it's hurting more now. As the sort of pain's coming in.
The team want Rob to undergo brain scans as soon as possible.
Good man. And just relax your hand.
Al's asking the police to conscript some helpers.
Do you want to go and see if you can round up a few of them army lads from down there to do the carry? Yeah. Yeah?
Well, it's a lovely day, so I came up with my wife and 10-year-old daughter. Thought we'd go down to that cafe, and rather than walk round, I was just climbing around a rock looking for a foothold. I put my hand out, and there was actually there was nothing there to grab, and I think I just fell backwards. I don't remember anything else, really. Day out from hell, really, it's turning into.
It felt like he hit something at the midway point and then just ended up flat on his stomach. And it was horrible. It was very shocking. It was just such a blur. It just happened so quickly because the immediate panic is, especially when it's a head injury, it looks 10 times worse than potentially it is. So it was just a big, horrible shock.
We can't really rule out whether you've hurt your neck. Okay. I don't really suspect you have, but just precautionary.
I appreciate that, thank you.
The army lads are getting their orders.
Hey, what we're going to do is, this is Rob, all right? He's fallen. We could do with your help to help carry him. Is that all right?
Yes, sir.
Yeah? I'm not sir. You don't have to call me sir. OK.
But getting Rob through the rocks and down to the helicopter is going to be far from easy.
Quite a crack to his head, so we can't rule out a neck injury, and he's still not fully with it.
He's still a long way from the hospital treatment he desperately needs. On the rugged edge of Ilkley Moor, the Helimed team have enlisted the help of a squad of young soldiers in a difficult rescue.
Can I borrow the tallest one of you lads for a minute?
The army apprentices came here to learn the ropes of climbing.
Right, you're Delta Sierra now. Okay. That's drip stand.
Now
right,
they could be helping save injured day tripper Rob's life.
We're just going to give him some pain relief and get him down onto our stretcher and carry him down to the helicopter and take him to the local hospital, which happens to be the trauma centre, LGI.
Now just sit yourself down. Okay. Okay, your head's going back down. We're going to lower you down. Okay.
No, mate, just take your time.
Yes, lovely. Well done.
Doing all right?
Great. Yeah, it's fine. No change. Nothing to worry about.
These guys are great.
Right. You see, you'll never complain about paying for your taxes ever again, will you?
Relax, you alright?
Right, so you've got an outstanding tax bill. I'll pay it Monday morning.
Yeah. Oh, look, you're causing them problems, love. You're a bit fat.
No, it's cool.
Yeah, don't listen to her.
We're
going to need a bigger stretcher. Right, guys, can we get you around this yellow stretcher now? Just six of you probably be enough.
Despite the banter, there's no time to waste. If Rob has a brain injury, speed is essential.
All right, on call, ready, steady, lift. This is all right. Can we underslung load for these all the time?
I'm 90% certain it won't be anything to be concerned about, but he has fallen quite a long way and he has landed on his head, so we need to just be a bit careful, just to be on the safe side, really.
In we come. Just lower him a bit now. That's high enough. All right.
Rob's going to be flown direct to the trauma unit, 10 miles away in Leeds.
All right, Rob?
Yeah, fine, mate.
Yeah, fine.
If he hadn't fallen for 15 foot, I'd have got some needle and thread out the bag in the back, sewn it up and sent him home.
I tell you what, I've got nagging right now.
You always have nagging right.
The rescue's been seen by hundreds of visitors to the rocks.
Clear left. Hello, Helimed and 9 Alpha.
Hello, 9 Alpha, please, good afternoon.
9 Alpha has slipped in from Carrick-Off, Ilkley, 5 on board now, routing LGI. Request clearance through the zone, please.
Helimed 98 will be landing in the heart of Leeds.
LGI, Helimed 98. That's us 2 minutes out from the north.
Landing here's not without risk.
Roger that, you're clear to land.
Roger. Helimed 98 Alpha.
Firefighters are on standby every time a chopper touches down on the rooftop helipad.
It's 0105 knots.
The trauma team is awaiting Rob's arrival. He'll be x-rayed and scanned before medics begin trying to close the wound in his head.
Okay, this is Rob, normally fit and well. About an hour and a half ago, he's been at Ilkley Moor with his family, taken a tumble, really landing on his head, striking his head as he's landed. He's been a little bit confused. The scalp injury, you can see the periosteum of his skull and through that, but it doesn't appear to be any damage to the skull.
Within a few minutes, Rob will be wheeled into the hospital's body scanner. Only then will doctors be able to rule out a brain injury. And the result is far from certain. The Yorkshire Dales covers nearly 900 square miles. But only 20,000 people live here. Some are a 2-hour drive from A&E. It means that when families dial 999, the air ambulance is often the fastest way to send help.
It's the ambulance service. Is the patient breathing?
And at the airbase in Topcliffe, another call is just coming in.
My little boy, he's not quite 2, he's just poured a boiling hot cup of coffee over himself and his skin's starting to blister.
What town or city?
Leyburn, we're just outside of Leyburn. Just outside because he's screaming so I can't hear anything.
Not to worry, that's fine. How old is he?
It's a child that's poured some hot coffee on themselves and reported area of burns is quite significant.
Desk 99 lifted at 34, over.
Paramedic Al is a new dad himself. This could be a difficult, distressing case.
Quite common for kids to grab out at cups and pans and things like that, and scald injuries of that type can be quite common. They're always very painful and uncomfortable and very distressing for the child, unfortunately.
Is he awake?
Yeah, he's awake from screaming.
Need to try and cool the area around. Obviously, might be.
But we are trying with cold tea towels and flannels and stuff.
Okay, well, just need to try and cool it with water there, okay?
Lisa Raywood knows the child may require powerful painkillers.
I'm just reading JR Calc, so an 18-month-old, total burn surface area between 10 and 20% and time to hospital greater than 30 minutes. They get 10 mils per kilogram.
Okay.
In a 2-year-old, dosages are critical.
We're just prior preparation and planning, looking at the fluid regime for a child with burn. Looking at our guidelines, so we're just rehearsing, making sure that we're both up to speed.
The patient's at home on a remote farm near the market town of Leyburn. The child's parents are being given first aid advice by ambulance control.
The parents always blame themselves, of course, but pretty much when anything happens to your kids, you kind of always think it's your fault. So there's always an element of kind of guilt as well as the kind of feeling the pain of your child as well. So it's a sort of it's always very distressing for parents, these sorts of situations.
Right, we've got 1.5 minutes to landing.
Okay.
Okay, I'm going to put it on the grass just beyond the track. Okay.
You're looking good, my side.
Thank you.
We're all clear this side.
The chopper crew are arriving at the same time as local paramedics. Lisa brings them up to speed.
Hiya, you all right? This is Finley. This is Finley, who's 18 months old. He's just been toddling around in his pyjamas, hot cup of coffee that had just been made on the side. I think he's gone to grab his milk, but got the hot coffee. Just the tiniest drop of milk, so it will have been quite hot. It had just been made.
Lisa's giving him a mild painkiller first.
You like that, don't ya? That must be the first child I've ever met that it doesn't end up all over his face and up his nose and... Right, have we got a toe, Finley? Can I borrow one of your toes?
All this attention is distracting Finley from the pain he's in.
Yeah. There. What we're going to do is put some cling film on, because what causes the pain with burns is the air hitting the...
We're not sure whether to put it on or not.
Yeah, no, that's fine.
Kitchen wrap protects the burn and prevents infection. But it's clear Finley's still in pain.
We could do with a bandage, couldn't we? Just to stop him pulling. Oh dear.
Stop it from stinging.
Make that phone call.
Or more, please.
Yeah, we could do, couldn't we?
2 milligrams for
yeah,
2-year-old.
Can I leave that with you and I'll just give him a buzz? He's just had some bruising stuff.
They're going to give him an oral form of morphine. It's much more powerful, with potential side effects. They'll need to monitor his condition closely from now on.
We're going to take him to James Cook. All right, so we'll fly him up there.
Oh, how exciting.
Finley's injuries urgently need to be assessed by specialists. Childhood burns can scar for life. Speed counts in cases like this, and the family home is an hour's drive from hospital.
Oh dear! It might upset him, but we'll just have to play it by ear and just roll with it.
Mum's going with him. He's being flown 30 miles to the trauma unit in Middlesbrough.
Okay, you happy to start?
Desk 99's lifting for James Cook.
Okay, we'll lift, we'll turn tail right, we'll go out into the 9 o'clock across the fence. And out the opposite direction.
Be good, right? I was quite impressed with this.
Good.
Helimed 99 is a familiar sight in the skies over the Dales. Taking Finley for treatment by road would have meant a 3-hour round trip for an ambulance crew.
Paramedics 99 Alpha finals for James Cook.
Paramedics 99 Alpha surface winds at Durham, 190 degrees, 12 knots.
Thanks to the HeliMed team, Finley will be undergoing treatment less than an hour after his accident. His mum is anxiously awaiting the doctor's assessment of his burns. It's yet another chilly morning at Topcliffe.
-3, pretty cold.
Paramedics Daryl Cullen and Lisa Raywood are used to it.
It's always chilly up here, even in summer it's chilly up here, but we're going to wrap up warm, out with boys. Yeah, we've got those sexy thermals on.
But over 250 more people per day in the UK die during the winter, and not just from acute trauma. Those with chronic medical conditions are at much higher risk, and many of these patients are frequent flyers in the air ambulance. Pilot Chris Attrill is responding to a call that's just come in from Thormanby, a small village about 10 miles north of York.
We're going to be first on scene, are we, Lisa?
Yeah, crew's greater than 20 minutes away, she said.
All right.
A woman has gone into an anaphylactic shock, a potentially fatal allergic reaction. Lisa thinks she's met the patient before.
So if it's the same patient, I went to this patient about 3 or 4 months ago. It can be a life-threatening situation, and time is crucial really to get treatment into the patient to stop it progressing into quite a sinister event.
Living just 5 minutes flight away from the base could make all the difference for this woman.
Clear on the left.
Receiver.
Clear of the tree. Got the domestics to the right, Chris.
You're good my side.
Yeah, no, that's fine.
Clear left.
Okay.
No, we're on the ground. Hey, just tell me what's been happening.
I'll give her free EpiPen. She's struggling breathing. She's been like sick all the time.
Okay.
Rachel Fildes is hypersensitive to food colouring, pollen and numerous other allergens. Even antihistamine, the medication often used as first-line treatment for anaphylaxis. Her partner Alan has given her oxygen and 3 shots of adrenaline, but she's still in a bad way.
Anaphylaxis. She's got anaphylaxis. She's got a brace there.
Rachel, Daryl's just going to wire you up to a few things so we know where we are, okay?
Monitoring is essential. Severe allergic reactions can cause a drop in blood pressure, which can result in dangerously low levels of oxygen.
Just get that held up to you a minute.
Anaphylaxis kills 20 people a year in the UK, and speedy treatment is vital.
Are you able to tell me what's happened?
Infection all week. Chest infection.
Apart from the chest infection, it's unclear what triggered the attack.
Right, Rachel, sharp scratch. Just try not to flinch, love.
The cannula goes in, but Lisa can only administer drugs that Rachel is not allergic to.
So, I'm just thinking, we can't give her any clofenamine, she's allergic to antihistamines.
Yeah.
Are you allergic to steroids? Give her some hydrocortisone, couldn't we? Have you ever had hydrocortisone before?
Yeah, you give it to me all the time.
Were you okay with it? You didn't have a reaction to it? It's all you can have, right? We'll give you some of that.
It's a powerful drug, but Rachel still only gets a few minutes between each attack. She may need a lot of help as she travels to hospital, so a decision has to be made.
Yeah, just a quick update. I'll travel down in the DCA with the patient over.
In cases like this, it's safer to go by road.
Yeah, I know you will be. Don't worry, we'll look after you. It's HeliMed 99 here. She's had an anaphylactic reaction this morning. She's had 3 of her own EpiPens before HeliMed arrived.
It's a worrying time for Rachel's husband. He's no idea what caused this.
No, she's been to her hospital at 9 o'clock this morning. She went to work today. Sometimes it just triggers it and then that's it. Because she knows what food to eat and stuff, so...
How are you doing? You're looking a bit better.
This is the 12th time this year Rachel's been taken to hospital. Lisa will be keeping a close eye on her patient throughout the 20-mile journey to York. Rachel's life could depend on her skills. When the HeliMed teams are called to provide emergency medical care, finding the patient can often be the trickiest task.
You've got to come up Hepworth Lane. You can't get to us down Grove Street. Right, OK, not to worry.
Yorkshire is a big place, so the accuracy of information provided by those on the scene is of paramount importance. But the next job for paramedics Pete Rhodes and Al Day should be the easiest of the week to find.
We've got a grid kit.
Sir Echo.
124204.
That's Featherstone Railway Station. They could practically walk there from the base here at Nostell Priory. Estimated flight time, 1.5 minutes. In theory.
That's about the shortest hop you're ever going to get.
The job itself also seems like it might be straightforward. A man has fallen down some steps, 25 of them in fact. But it's still a common accident.
Is it the railway station or the level crossing?
The railway station.
This might be as local as it gets, but something doesn't add up for pilot Andy Lister.
It doesn't look like there's 25 steps in there.
99 to air desk.
99 from air dispatch message.
Yeah, can you just confirm, is it Featherstone Railway Station we're going to?
But then, a breakthrough.
Hang on, there's some steps going down.
There's a subway.
There's an underpass.
Right. Where?
Underneath the railway.
Andy puts Helimed 98 down in the nearest available spot, but it's a hike to Featherstone Station.
Oh mate, you're right.
As Pete finally gets a view of the steps in question, it's clear how far the man has tumbled.
Hey mate.
Knee gave way coming down steps.
Right.
He says he's actually rolled all the way down. But there's
Right.
quite a gap in between.
Yeah.
Non-epileptic, diabetic.
Yeah.
Complaining pain, cervical pain.
What's your name, fella?
John.
Tom.
John.
John. Sorry, John. I'm Pete.
Right.
Right, John. Where's it hurting worst at the moment?
Mainly lower back.
Your lower back. Sorry, fella. We're gonna be coming at you from all angles, I'm afraid. Can someone chuck us some cannulation stuff? I'll get a line in for you while you're doing your bits. Right, so you're all right with morphine, yep?
Yeah.
Okay. Had any alcohol or drugs today?
No.
Right, so let's have a quick racer. So, airway's fine. Breathing reasonable. You're happy with his chest? It's clear?
Yeah.
Daft question. This pain at the bottom of your back.
Yeah.
Give it a number between 1 and 10. What number would you give it?
About an 8.
About an 8.
Yeah.
Okay. John, can you wiggle your toes, mate? Can you feel me doing that?
No.
Just gonna rub your foot, mate. All right. You feel that?
It's a worrying sign. This might not be a straightforward tumble.
We've got negative Babinski's at the moment, so we're just going to have a further assessment, get them packaged up, and I think roads probably would be better over.
Testing the Babinski reflex is a way of seeing how well the nervous system is working. In adults, toes down are good, toes up are bad. John's response could indicate damage to the spine, but then he reveals a crucial piece of information.
Right. So it's normal for that, yeah?
John has a muscular condition which alters his sensitivity to pain. It could also explain why he fell down the stairs.
So you've got fibromyalgia, John? Yeah. So and normally you can't feel the low knees anyway. All right, fair enough. Up in your mouth.
After a dose of morphine, John's ready to leave the less than hygienic environment of the subway.
Okay.
Even now, paramedic Al is not certain about his patient's condition.
It's a little bit difficult to assess as to whether what he's experiencing is a result of a fall and an injury to his back, or whether it's just his normal kind of medical problem that he has. So just to be on the safe side, I'm going to immobilise him and then he'll probably go up to LGI.
Despite his trip to hospital, doctors are sadly unable to pin down the precise cause of John's fall. But he's leaving the medics in no doubt about one thing, and that's John's devotion to his favourite band, as proved by his full name.
John?
It's not every day you get to rescue rock royalty.
Don't worry, John, we're halfway there. Featherstone is quite renowned for its sort of celebrity areas. I think Obama's visiting later on today to go to the Chippy, so, you know, it's mixing with the high life again.
Helimed 98 leaves without a patient.
It's quicker for him just to go by land to Leeds. It's a lot better for the patient.
And Alan Pete are on a roll with Bon Jovi's back catalogue.
Yeah, keep the faith and hopefully we'll be all right.
Well, you know what, Al? I will always love you.
Factory worker Tony underwent surgery on his left hand at Sheffield Northern General Hospital. But doctors were unable to save it and it was amputated. He's now returned home and is adapting to life without it. Elizabeth, the elderly passenger trapped in an overturned car, spent more than 3 weeks in hospital, but recovered well and is now back home in York.
He's had 50 milligram of ibuprofen given by Mum, and he's had 2 milligrams of Oromorph by us.
Little Finley, who spilled a cup of scalding coffee, was found to have only superficial burns, and he's now back in the Yorkshire Dales with his relieved mum.
1, 2, 3. It looked awful. I think it looked a lot worse than it was. We thought it might have hindered him a little bit because it's on his shoulder, but no, he's still climbing the furniture, he's still, you know, trashing the house, so he's not at all fazed by it.
Scans at Leeds General Infirmary revealed that day tripper Rob escaped serious injury when he fell from one of Yorkshire's most famous landmarks, but it was a close call. And Rachel, whose allergies have landed her in hospital a dozen times, was put on a 2-week course of powerful steroids. The cause of her anaphylactic attack is still a mystery.
It's difficult. It's obviously difficult for friends and family. Close friends and family have got used to it. But for sort of onlookers, it's quite frightening to see suddenly somebody just swell up and go and can't breathe. And it tends to be the onlookers that panic. If I panicked, I won't be here.
The other John Bon Jovi lives in sheltered housing in Featherstone and uses a wheelchair following his fall. But he's still a rocker at heart.
Yên chưa? Một lần à? Bak kayo. suami kerjawi je lah.
Tak cool like that.
Saya encah, semua lang ah. Ah, mak kayo. Tapi sikit lah. Suami kerjawi je lah. Tak cool like that.